Hello.
Hello. Hi, Michelle. Hi, Huang. to meet you virtually, though you're not far away.
Yeah. Hi, Marinka. Great to meet you indeed. We also have Gabriele over here.
Okay. Hi, nice to meet you.
Nice to meet you. Have you seen any other of the content of the Learning on Graphs conference so far already?
Yes, I've been online yesterday attending some of tutorials. Most of my time I spent at the graph rewiring tutorial because I was also on a panel there, but a few others were interested as well as some orals. So overall, this has been a big success in terms of organizing the conference, and really particularly a big thank you to student organizers who did all the hard work. It's really impressive what you were able to pull together.
A lot of the hard work was also done by Bastian Enrique and Rasan Pascano, we have to say though. Bastian Enrique is just amazing what he does for the community.
Yeah, I fully agree. I think he's really great, and wonderful that they both have volunteered this year to lead the program committee and selection of papers for the proceedings. Yeah, so I think certainly it would be good for the conference to perhaps have a post-mortem meeting or kind of discussion on how to organize best the venue so that the next year conference will be even a bigger success. It's just fascinating to see how much enthusiasm there is from the community in Slack workspace across so many different channels where people are interacting with each other and then asking questions and following up on various topics presented in tutorials and orals and posters. So really impressive.
Yeah. We most definitely are planning to have a debrief meeting, not only a debrief, but like an organizational meeting where we discuss how to organize next year. And we just this morning we were already discussing a little bit on Slack with each other how to best go about it. But yeah, let's first finish this conference and then we'll see further.
Yeah, of course.
Wonderful. All right, just on the dot of the hour, so let's begin. Welcome everyone.
Michelle, actually,
yes.
I would wait a little bit.
Okay.
Because
lots of people are still in the other town, as far as I see.
It's just after the poster sessions, right? And I think
that's right.
People are still coming from the gather town into the poster session, and I would, for example, also just shoot in a quick message into the gather town group to that we are that the keynote is starting.
Sounds good. So I'll just briefly introduce you, Marinka, and then you're welcome to share your screen anytime afterwards. Great.
Thank you, Michelle.
Then these messages out. Okay, but I think many people are already joining. All right, and we also have our tweets out and full advertisement. But I think we have the obligatory 2 minutes. Now it's 2 minutes and not only 1 minute after the mark of the hour, and I think it would make sense to start.
Okay, great. Well, welcome everyone. We hope that you had a great time at the second poster session earlier today. So to give a quick overview of the rest of the schedule, we'll have our final keynote. And then next up, we're going to have some more oral presentations. Then we'll have a talk from one of our sponsors. And finally, a closing statement from the organizers. But now I am very pleased to introduce our final keynote of this year's Learning on Graphs conference. So Professor Marinka Zitnik is an assistant professor at Harvard University, where she leads a group that innovates geometric deep learning methods to enable scientific discovery in precision medicine. Her algorithms and methods have had a tangible impact, which has garnered interest from government, academic, and industry researchers, and has put new tools in the hands of practitioners. Some of her methods are even used by major biomedical institutions, including the Baylor College of Medicine, Karolinska Institute, Stanford Medical School, and Massachusetts General Hospital. Her work has also received Best Paper and Research Awards from numerous institutions, honestly too many to name in this short period of time. But we are so honored to have you join us, Professor Zitnik. And without further ado, I'll hand it over to you.
Okay, hello everyone. First, thank you so much, Michelle, for this kind introduction. I'd like to start by thanking to the organizers, in particular student organizers who have really made this conference, I think, a tremendous success. I was very pleased to have following the various discussions across multiple Slack channels and attending some of the content over the last few days. So certainly kind of a big thank you for bringing the diverse community together and consolidating this exciting area of research into an important field for machine learning. So with that let me begin my presentation today. So I'm sharing my slides. I hope you can see the title slide. I will talk today. Thank you. I will talk today about graph AI and its uses across areas relevant to precision medicine, and so I'll also highlight how some of concrete scientific questions and medical questions can motivate the development of core new methodology. Throughout the talk, I will mention various papers and studies and data sets, and most of them, if not all, are available from our lab website that you are more than welcome to check out, where you will also find additional resources, including tutorials and Colab notebooks and so on. Okay, so what we are seeing is that with increasing availability of various data sets and data types available to describe the state of an individual person, we witness a tremendous influx of using advanced computational methods, in particular machine learning-based methods that can help identify and advance questions related to diagnosing patients, figuring out what would help an individual who is not in a healthy state, move them towards becoming a healthy individual. And so I will focus to organize my today's talk around two big topics, which is that on how graph AI can help us advance the diagnosis of patients, in particular those that are most difficult to diagnose, where conventional medicine fails for them. And second, I will talk about, well, once we have patients that we have diagnosed, the next big question, of course, is how can we design therapeutic interventions that would reverse the disease effect so that individuals will go and can go about leading their life. So I strongly believe that graph learning is poised to reshape precision medicine across those different facets. And throughout the talk, I will highlight applications where the use of graphs was not only a convenience, but it was necessary to solve the problem. So with that, let's start with the first part of the talk, which focuses on diagnosis, the first big pillar of precision medicine, and then we'll followed by development of therapeutics, which is the second big pillar. On the diagnosis end, the project that I want to highlight is really motivated by the observation that there are actually numerous diseases that are very hard, that are relatively common to take considered collectively, but they're very hard to diagnose by conventional medicine. And in particular, the term that is used to refer to those diseases is rare diseases. There are over 7,000 rare diseases in the US. And each of those diseases is defined as a disease that would affect between 150,000 individuals according to the US standards, or 200,000 individuals per year in Europe, for example. And so while each of those diseases might individually be rare, meaning it has relatively small number of patients that have that disease compared to some of the common diseases, collectively, when we go across the entire spectrum of those diseases, they become very common, and they affect, on average, 150 to 300 million people every year worldwide. The problem with these diseases is that they're phenotypically very heterogeneous. So that means that when a patient comes to the clinic, or multiple patients come, they might have the same underlying diseases, but very different set of symptoms. Because of that, frontline clinicians who see those patients might not be able to diagnose them, because those patients are very rare, they have not seen them during their training, and that can lead to expensive clinical workups for patients that could span across multiple years of time. That diagnosis often requires specialists, subspecialists, multidisciplinary referral, and on average, the kind of sad statistic is that this long search for a rare disease diagnosis can take 5 to 7 years. Patients need to visit 4 to 8 physicians and are often misdiagnosed. And this diagnostic delay is so pervasive, and that leads to problems for patients. It's referred in the literature as diagnostic odyssey, because patients need to go from one doctor to the other. They need to take a redundant testing or unnecessary medical procedures, and that could sometimes lead to irreversible disease progression, meaning that the time it takes to diagnose the patients is so long that the optimal time for intervention to treat the actual disease or the underlying causes is missed, and meaning that the patient could, some of the problems could not be reversed anymore. So it's an obvious question to ask nowadays: can machine learning help us shorten diagnostic odyssey for rare disease patients? Can we go from 5 to 7 years and compress that timeline to months or weeks in some cases to really provide fast and rapid diagnosis for those patients? The problem of AI-assisted medical diagnosis is not new. In fact, deep learning models trained primarily via supervised learning on large labeled data sets have been shown over the last few years that they can achieve near expert clinical accuracy for common diseases. And so a few examples are listed here on the slide. Particularly famous examples relate to the ConvNets trained on hundreds of thousands of retinal images for the purpose of diagnosing diabetic retinopathy and molecular edema. And in fact, earlier this year, FDA has approved the first autonomous AI for diagnosing diabetic retinopathy, where diagnosis is made purely by the algorithm. Another famous example relates to training a deep learning model on skin lesions, in particular, over 100,000 clinical images of skin lesions to develop a model that can recognize different kinds of skin cancer. And most recently, models have been trained on over 1 million pediatric patient visits to treat and diagnose common childhood diseases. However, the challenge with rare diseases is fundamental and fundamentally different from these prevailing uses of AI for medical diagnosis, because data sets are over 3 orders of magnitude smaller than in other uses of AI. And because of that, we need completely new approach in order to enable the use of ML for rare disease diagnosis. And why is this so? Why this approach needs to be fundamentally new? Because we cannot solve it with current prevailing techniques for solving the problems where we have small labeled data sets. So rare disease diagnosis cannot simply be solved by recruiting more patients or labeling more patients, because of the high disease heterogeneity and because of relatively low prevalence for every disease. And it cannot be solved by supervised deep learning, because models are required to extrapolate to novel genetic diseases, to atypical representations of diseases. So things becomes fairly complicated in that regard. So since we are in kind of a graph learning conference, it's kind of this project perfect fit to discuss here, is because we were able to address this problem by developing a graph neural network-based approach, which is called Shepherd. And fundamentally, Shepherd proceeds in 2 stages. So the first stage is actually a stage that does not require any patient-level information. The approach is to take a large precision medicine-oriented biomedical knowledge graph and then use self-supervised pre-training through a series of auxiliary tests that are primarily defined based on link prediction in order to generate an embedding space of genes and diseases and phenotypes that capture known biomedical relationships. Once that process is finished, then in step 2, the pre-trained GNN from step 1 is fine-tuned using a large number of synthetic patients. And so that clever idea of how to use the synthetic patients, which is due to the students that led this project, has enabled Shepherd to be able to provide diagnosis for patients that are rare disease patients. So the pre-trained GNN from step 1 is in step 2 fine-tuned exclusively on synthetic patients without the use of any real-world labeled patients, as there are and aren't any for many diseases. And so the way this fine-tuning process is done, it is done by optimizing the model for 3 different diagnostic tasks that are important in medical diagnosis. And so the first diagnostic task is that we refer to as causal gene discovery. So the task here is presented to as the model to solve that given a patient set of phenotypes, think of them set of symptoms, plus a list of genes in which the patient has mutations. The model is asked to prioritize genes, produce a ranked list of genes, such that at the top of that ranked list of genes would be genes that harbor mutations that cause the disease. The second diagnostic test the model is considering is that given a patient, again in the set of their list of phenotypes that the patient has, can we find other patients that have similar genetic or phenotypic features that could be then suitable for clinical follow-up? And this is known in this area as patients like me type of problems. And the third final task is important for characterizing novel diseases and novel or atypical rare diseases, where the task is given a set of patient symptoms, patient phenotype. The task is to provide an interpretable NLP name for the patient diagnosis, the disease, based on the similarity of patients' phenotypes to known and well-characterized diseases in the knowledge graph. So the way the Shepherd model is then trained, it is trained by solving these 3 diagnostic tasks using over 36,000 synthetic patients, and synthetic patients are generated using a different approach that I will not be detailing in this talk, but I highly encourage those interested to check out the paper, using a principled simulation pipeline that can generate realistic patients that are hard to diagnose and for whom the conventional medicine would fail. Once the model is trained purely on synthetic patients, we can evaluate the model. And because the model is trained on synthetic patients, the model can be easily shared across multiple institutions without breaching any privacy concerns. So in the results I will show you next, we evaluated the model on 2 patient cohorts. The first patient cohort is a real-world cohort from UDN, or Undiagnosed Diseases Network. It's a cohort that has 465 rare disease patients whose diagnosis is known, and those patients span 299 diseases. So you can see that on average per each disease, we have only a handful at most of patients with that disease. And that said, one could say, well, that might be because UDN is such a big cohort. Well, in fact, UDN is the leading nationwide cohort supported and funded through NIH in the US that spans 12 clinical sites throughout the United States, recruiting patients that otherwise are very hard to diagnose and then trying to provide through years of work their molecular diagnosis. And so you can see how this is really a big, challenging, lengthy process to find diagnosis for a relatively small number of patients. The second cohort that we consider here is MyGene2 patient cohort, sorry for the typo here on the slide, which is a cohort of 146 rare disease patients that span 55 diseases. So let me show you some key results of Shepherd being evaluated on these two cohorts of real-world patients. And I will split results by 3 key diagnostic tests that we have seen a few slides ago. So first, our results on causal gene discovery or causal gene ranking. So one thing to ask is, well, first, how accurately can Shepherd rank genes for those 450 patients, in the sense that can it find the genes that contain causal mutations for those patients and rank those genes very highly in their predicted rank list. Ideally, we would ask that we would prefer those genes to be found among top 1 or top 3 or top 5 hits. And so what we can see that Shepherd, compared to traditional information theoretic approaches, various network science-based baselines, as well as shallow embedding methods, outperforms the quality in those methods and produce ranked lists with higher quality in terms of causal genes being pushed towards close to the top of prediction list. The part that I'm most excited about is the part that Shepherd can perform particularly well on those patients that are most challenging to diagnose. And so in panel B on this slide, we show the rank at which the ground truth causal gene is found in the predicted list as a function of the distance between the causal gene on the knowledge graph and the set of phenotypes that the patient would actually have. And so what we find is that for 75% of patients whose phenotype symptoms are actually far away from the gene in the knowledge graph, so it requires multiple hops of nonlinear indirect reasoning by the model. In those, even for those cases, Shepherd can find a causal gene among top 5 genes that it predicts. And so that's quite exciting. And of course, additional studies are important where the model would be made. We want to make sure that the model can perform well if we evaluate it across different clinical sites to demonstrate that it's not that it can cover various geographic regions across time by splitting the data by disease diagnosis evaluation year and across different diseases that are in patient cohort, which is what panel A shows. And across those different splits and different dimensions the model can be evaluated on, the model performs very well. The next diagnostic task relates to patients like me model. And so here, the way you can think of this task is primarily as a retrieval problem, where given a patient, here represented, here shown an example for 4 patient case studies, and each patient is represented by its own patient card. And then given that patient, we project that patient based on their clinical and genetic data into the embedding space. And in the embedding space, ask, well, what are nearby diseases and nearby patients of the projected patient in the local embedding space. And so what we can see here is that if we look at nearby diseases in the embedding space where the patient gets projected to, we often find that among top 5 other patients that the query patient is positioned nearby are patients that are very relevant for the query patient. And so this indicates that this latent embedding space the model learns is suitable for asking these kind of queries and for solving retrieval tasks. And this is really important because once the model can find other patients that look like the query patient, then knowledge about diagnosis or treatment down the line can be transferred to the query patient. And finally, one of the reasons why these diseases are so challenging to recognize is because they're often presented in the clinic through in atypical manner, or it might really be the case that the patient that that enters the healthcare system might have a novel genetic disease that has never been seen by the healthcare system before. And so because of that, a good model would have the ability to provide some way to characterize a novel disease if the model suspects that the patient would have a novel disease. And so the way this is approached by Shepherd is that for a given patient card, and again, here on the slide are shown 4 case studies for patients from undiagnosed diseases network cohort. For that given patient, based on their phenotypic representations, then we ask, well, what would be characterized diseases in the embedding space that could explain the set of phenotypes that the patient would have? And so if that means that if patient have novel disease, it would be that has not yet been recorded in medical knowledge before, what the model would return, it would return a mixture or distribution over the range of known and characterized diseases, and therefore allow the experts to get an interpretable name in English language about how this novel disease might look like, a certain percentage of disease 1 or some other percentage of disease 2, and so on, where disease 1, 2, and others are characterized by medicine. So let me share some of the takeaway messages that I think are important for the audience here, even though you might not be interested in medical diagnosis or rare diseases in particular. So first, I'd like the point to make is that Shepherd overcomes limitations of standard GNN learning here by kind of coming up with a clever, ingenious idea to model the inputs in terms of patients as subgraphs of the knowledge graph, where every patient is then represented by a subgraphs of phenotypes that the patient would have, and that signal is overlaid on a knowledge graph of prior biomedical knowledge. It uses self-supervised pre-training on biomedical knowledge to deal with the problem of having small number of labeled examples per class per each disease. And it can do so because it trains the model on a large cohort of synthetic patients. I would argue that a very exciting future direction for the field here and for some applications in science and medicine is kind of thoughtful use of synthetic or semi-synthetic data to enable broad generalization or robustness. So the broader implications of this work is that first, I think it kind of points or hints to the future where we might hope to have more generalist type of models that are able to ask different kinds of tasks across diagnostic processes. And it can create new opportunities for using deep learning on medical data sets with very few labels. Most importantly, here, it's for the audience here, the use of GNNs here was not only helpful or a matter of convenience, but was necessary to be addressing this task. And so this is an example of a problem where geometric deep learning has really kind of excelled. And of course, this work has been led by 2 outstanding and wonderful students, and particularly Emmy Alcenser, to collaboration with Zach Lab here at Harvard, and Michelle Lee, who's a star PhD student in my group. So let me go now to the second part of the talk. And so we will change now gears from diagnosing patients, recognizing what diseases they might have, to the question of, well, once diagnosis is realized, and well, what kind of therapeutic intervention can we offer to those students, to those, no, not students, hopefully, to those patients? And so my second part will focus on the question of therapeutic discovery and development. And so this topic has been brought up, I believe, by several of the talks, this conference, as well as a few other keynotes. So I will kind of summarize it or motivate it relatively briefly by the notion that for the question of therapeutic science, or the critical capability is that of being able to model structure, geometry, symmetry, and knowledge of complex systems. And I think because this is such a critical capability, we are seeing there's a lot of use and emphasis on development of geometric ML models for these problems in therapeutic science. And that is true across multiple scales of biological organizations. If one is modeling individual molecules or groups of molecules, if one is modeling genomes and relationships that exist between genomes, as well as various regulatory relationships that exist within a genome, as well as the highest level of organization, where we have data about populations and their behavior that is often represented in the form of knowledge graphs. And second, to a critical capability for therapeutic science is often also the need to be able to bring multiple sources of biological data together and model that data in a joint manner, because there is typically no single data source that could capture the full complexity of a therapeutic candidate or a disease that we want to design therapeutic intervention for. So it becomes crucial to be able to consider both experimental, curated, self-reported data that might be generated by different measurement platforms. Each of them comes with its own distinct inductive bias that we want to model. So with all these kind of questions in mind, and also opportunities that we see ahead in this area, both for algorithmic innovations as well as for advancing the science and developing and accelerating development of safe and effective therapies, we have recently initiated a coordinated open science community that we refer to as Therapeutic Data Commons. So Therapeutic Data Commons serves as a meeting point between, on one end, biomedical scientists, biochemists, who identify meaningful tasks and data sets across the entire drug discovery pipeline that are at the cusp of benefiting from machine learning. And on the other end, machine learning scientists who can design state-of-the-art ML methods once those tasks are identified. And so the purpose of that is to facilitate, on one end, both algorithmic innovation, kind of help provide benchmarks and leaderboards for new exciting geometric deep learning methods, as well as practically help accelerate therapeutic science research and translation into biomedical clinical practice. Within Therapeutic Data Commons, we provide a large number of machine learning workflows. Each of them is designed for a different drug discovery task. Typically, a workflow comes in the form of series of operations, starting from formulating meaningful therapeutic machine learning tasks that TDC provides, to sourcing and processing biomedical data, providing an ecosystem to develop powerful machine learning models where one can use then retrieve data sets for a given task and then develop their models in a variety of popular deep learning frameworks, from Python geometric to Hugging Face and everything in between. Evaluate model performance once the model is implemented, and compare it to state-of-the-art models for the task at hand, all with the purpose to identify what is the best-in-class algorithm and what are for a given task, and what algorithms are most suitable for that task, and why would that be the case. We really would like to develop more rigorous foundations on understanding what algorithms and associated theory are important and what capabilities are critical for specific therapeutic tasks. All that is enabled by a broader ecosystem of mathematical definitions of therapeutic tasks, a large number of machine learning ready data sets that can be retrieved very easily with a few lines of code, as well as various supporting functionalities that come in the form of data functions, model evaluators, and finally leaderboards and benchmarks that the community can use and check out when going about their research. So currently data sets in TDC cover a range of therapeutic modalities, but I would say that the broader coverage is that of small molecular research. This is also the type of therapeutic modality that has received so far most attention by graph learning community. I strongly believe that other types of therapeutic modalities, such as modeling biologics, antibodies, peptides, miRNAs, or gene editing therapies, where geometric deep learning has not yet been used or developed for extensively, creates the kind of opportunities that we have seen over the last few years in machine learning community that was enabled by small molecular, big data sets with small molecules. And though, in addition to providing these data sets, those data sets span across the entire range of drug discovery pipeline, going from early drug design, where the main question becomes that, or finding molecular structures with acceptable biochemical profile and optimized therapeutic targets, to preclinical research concerned with modeling activity of those molecular candidates, and later in clinical or post-marketing research, questions related to modeling efficacy and optimizing efficacy of drugs for specific patient populations, predicting safety, adverse events, and supporting manufacturing and synthesis of those therapeutics. So throughout the span of this process, machine learning tasks are defined that are ready for ML community to leverage upon and develop algorithms for. So Therapeutics Data Commons is a coordinated open science initiative. It consists of a collection of scientists and PhD students, as well as industry collaborators across a broad range of institutions that work really hard to try to provide an organized view of this exciting field of advancing geometric deep learning for therapeutic science. And I highly encourage those who are interested to check the research out or get in touch with us through various sources and channels. What I want to spend the next 10 or 15 minutes on is to give an overview of some of the compelling uses of the resources that are provided in the Commons. And so before I do that, kind of a broader overview of the uses that we have seen by the community using Therapeutic Data Commons that really span across numerous different, very distinct and different problems. And so what we have seen so far is that the Commons has been used in the context of data sets and tasks and broader Python ecosystem that it provides for predicting molecular properties based on large chemical libraries and optimizing molecules to have an acceptable profiles for a given therapeutic question later on, once those candidate molecules are identified, figuring out whether those molecules would bind to candidate therapeutic target in the actual cell to elicit the therapeutic effect. And we are also seeing increasingly the adoption and use of the resources in Commons to support research in molecule generation and AI-driven drug design, where the question becomes not that of only predicting properties by actually generating objects that satisfy certain design criteria, and doing so in a way that objects that are generated, in this case molecular structures, can be synthesized in the lab, as well as be diverse and novel relative to those objects that we already know as the field. And finally, there is a broad range of uses of the Commons that are concerned with therapeutic use prediction, primarily around drugs that are already available on the market and how those drugs can be further developed by expanding their use and indication for novel diseases, for diseases that have few treatments in the context of drug repurposing, as well as for modeling safety of those already available drugs across patient populations. And so I want to give highlight of some of these uses, and that will consist of two parts. And so the first part relates to the kind of more general view that we have in the group about how to go on designing therapies that can be effective and safe for patients. And kind of that part is motivated by the observation that for many diseases, the way they kind of manifest themselves in humans is that they tend to disrupt normal behavior of genes and biological functions that those genes perform. And so then effective therapies and drugs can intervene against the disease by restoring the function of those genes that were disrupted by the disease. And so kind of with that in mind, then the design of effective therapies becomes that of designing therapies that can target those genes that were altered by the disease, as well as their surrounding biological context, which we often think of as biological networks, since there might be multiple genes performing the same biological function in the cell. And so then that creates an opportunity to figuring out what kind of genes should be altered or perturbed or targeted by the drug in order to reverse the disease-associated effect. So with that in mind, then the kind of data representations that we're looking at relate to constructing large biological networks. For example, the human interactome that consists of the proteins encoded by human genes and physical contacts between those proteins, and then figuring out what compounds could intervene against certain subset of proteins in that network that were targeted by the disease and essentially altered by the disease, so they cannot perform the function we would expect from those proteins to perform in healthy cells. And so the way we approach that is by looking at these large biological networks that consist then not only of genes and proteins in the way they interact to each other, but we need additional information about what are all the known biological processes, pathways, and molecular functions that those genes and proteins perform, so that we can get an understanding of what would then be the best compounds and drugs that can intervene against the set of proteins that were altered in the disease. So recently, a model that we refer to as TIG's GNN model is a model that's trained on a large precision medicine-oriented knowledge graph that brings these multiple scales of biological information together in order to effectively learn a mapping function that can identify what compounds and drugs could intervene against the disease based on knowledge of what the genes are mutated in the disease and knowledge of what proteins are targeted by the compound. And so that the critical idea of TIG's GNN is that on modeling not only individual nodes represented in the knowledge graph that represent compound nodes or disease nodes, but really have a broader view and be modeling local subgraphs. And so the way you can think of that is that for every node in the larger context of a knowledge graph that is part of the input, then the model learns learns their embedding functions, as we can see in various standard GNN models, but then it also learns some notion of a subgraph signature function or a similarity metric that can relate different nodes, different diseases and their local neighborhoods to each other and different compounds to each other. And so once we have that similarity captured between compounds and between diseases, we can effectively use guilty by association principle to recommend new treatments for a given disease or to expand the use of a given drug for new disease areas. Why are local subgraphs important to consider here? So in addition to having a domain or application-specific motivation, we can also have a more rigorous machine learning motivation for this use, which in our case is that of just being able to train these models on very large knowledge graphs where we want to effectively capture much of the influence that the relevant parts of and relevant biomedical concepts would have on the target node. And so within the model, what you can see that the influence of a node in the local neighborhood on the target node would then decay exponentially in the architecture that we're considering as we go further away from the target. And so that for us, it means that the local subgraphs around the target nodes, these dense regions of the knowledge graph that the model is focusing on, contains much of relevant biological knowledge, and then we're considering local subgraphs can preserve near the same kind of feature information as doing that on the message passing on the entire graph, which is what we would not want to do. Conceptually, the way to think of the value the subgraphs provide is that we often consider two kind of fundamental sources of predictive power in graphs. And so one is driven by the notion of propagating labels and nodes with the same labels and properties along edges of the graph, fundamentally relying on the assumption that nodes that might have the same label are found nearby in the graph. They're in the same graph region. And on the other end, we have the structural similarity part of it, which is complementary to label propagation. It says that nodes with the same label might not be close together or proximal in the graph, but they might have similar networks, signatures, or network shapes in their local neighborhoods. So in our context, what that means, if we want to use the model for diseases that have very few treatments and prioritize compounds for that, it's important to recognize that label propagation on its own will not be sufficient, because we cannot reliably propagate a small amount of label information about disease treatments effectively along edges of the graph, and we need to better leverage structural similarity for those diseases with few treatments. And that is exactly what the GNN model kind of allows us to do. Let me show you some of the kind of a few results of this approach when implemented in biology. And later on in medicine. So first is, recently we used an approach I described to prioritize compounds, and particularly drugs that are already on the market, for their potential use to be efficacious and safe against an emerging pathogen. So using that approach, the 918 predicted chemical compounds were screened for efficacy against the emerging pathogen, first in African monkey cells and then in human cells. So the results of that experimental screening in the wet biology lab was that we obtained a near 62% success rate among top 100 ranked compounds, in contrast to what would be a 0.8% success rate or hit rate if the screening of compounds in the wet lab would not be informed by the ranked list produced by the model. And so this is significant because it shows that it provides an order of magnitude higher hit rate among top 100 drugs than alternative approach. Furthermore, we were interested in knowing, well, is there anything common to those compounds that were predicted by the model and experimentally verified? What is common to those compounds, if anything, in terms of their biological mechanism of action, in terms of their kinds of proteins they target, and how those proteins interact with each other? So what we found is that 76 out of 77 predicted drugs that were experimentally shown to reduce infection in the lab were such that they do not bind directly to proteins targeted by the pathogen. So kind of a pictorial view of this mechanism of action is shown in the bottom right part of the slide, where there is an example of such a drug, D3, shown in green. And so D3 would target proteins that are not directly attacked by the disease. In fact, those proteins, through a series of cascading effects, would finally reach the human proteins that are attacked by this emerging pathogen. And so this is significant because it says that the drugs that were identified, and they have real effect measured by experiments, they fundamentally rely on network-based mechanism of action, meaning we could not identify those set of drugs by alternative molecular docking strategies. And so this is another example of where the use of graphs was not, again, a mere convenience, but it was crucially needed to identify this group of drugs, which we refer now as network drugs in the field. Beyond modeling emerging pathogens and a virus in specific, which I showed in the previous slide, this notion of examining local subgraphs around diseases and compounds that we want to associate to each other based on disease treatments can be applied to other disease areas, and particularly to diseases that currently have no known treatments or very few treatments. So the plot here on the slide part of on the right side of the slide show performance of GNN as a function of whether the model is asked to prioritize compounds for diseases that have many treatments already and are better molecularly and phenotypically characterized in the first group, and diseases that have currently very few or no treatments approved for them, and also limited prior biological knowledge. And the part that we are most excited about is that for this scenario B, that corresponds to diseases with known treatments and poor molecular understanding of diseases, which are therefore the hardest challenging diseases to predict, the model can produce improvements on the range of 49 or 46% over the kind of the standard knowledge graph-based GNN model. And this is particularly exciting because the value of predictions for those diseases is the highest, as they have no treatment. So the ability to prioritize compounds and put close to the top of the ranked list those compounds that are then effective for those diseases is important. And so one of the ways we evaluated, further evaluated the performance of this model is by going to the FDA and ask them on what are the drugs whose indications and use, therapeutic use, was expanded for novel diseases since after the time the knowledge graph used to train the model was built. And so that for our case was June 2021. So then that's the date when the knowledge graph used to train the GNN model was built and updated. So we went to the FDA and asked, well, what are all the drugs whose therapeutic use was expanded since June 2021? And this table here, shown in the bottom of the slide, shows the list of those drugs, their active ingredients, what diseases those drugs were indicated for, and when was the approval date. And you can see it starts from Valirec in August of 2021 to most recently in May 22, Vitama, which is a name for the active ingredient that is Stepinarof, was indicated for psoriasis by Dermavant. And so for each of those real queries, we asked the model, well, where would that drug that was approved most recently be found in the ranked list of all drugs that the model would prioritize for a given disease. And so in several instances here, we find, for example, for the Valirec drug that was found among top 4.11% of the drugs, or all drugs ranked by the model as candidate therapeutic opportunities for von Hippel-Lindau disease. And so we further evaluated these predictions by setting up collaborations with medical scientists at Mount Sinai in New York, who can examine predictions returned by the model for the selected disease areas, and then also give them the ability to and support them in interacting with AI predictions and interpreting their conclusions more readily. So domain expert can then ask a question, such as, will a form of will clozapine treat unipolar depression? What would be the candidate disease treatment mechanism? And kind of parts of the model outputs, including embedding space, predicted scores, and explanations of GNN predictors would then be presented to users. Performing a user-centric study with those domain experts, we wanted to really ask them, are these kind of tools and predictions and outputs that the model is providing, are they really useful to them in the context of, can these boost their the accuracy of their decision making? Can these AI-enhanced interfaces boost their confidence and help them decide what are predictions made by the model that are most trustworthy and relevant to follow up versus those predictions that would not be likely yield results in a downstream biological experiments. And so what we found generally is that these kind of graph-based models, when presented in appropriate way to domain experts, can really help them understand or brainstorm then effectively through biological knowledge what kind of biological mechanism a given drug might have to be effective, and whether that would make sense based on the knowledge of biology of the disease and chemistry of the drug. So I will make a few concluding remarks, and so perhaps more on the technical side than what I mentioned in the last few slides relate to kind of advancing the these GNN models, pushing them closer to biomedical and clinical implementation. And so doing that often raises questions regarding the ability to interpret and explain model predictions. This is not unique to biology and medicine. We are seeing GNNs increasingly used in various other critical applications. And so because of that, it becomes essential to ensure that relevant stakeholders can understand and trust GNN predictions. And so this has been addressed in the field by a variety of algorithms developed that are known as GNN explainers that use different techniques, including perturbations or exploring of the gradient or surrogate models, to try to give a sense of what are the parts of the input graph that models relies on when making a particular prediction. So the big challenge that I see in the technical literature with that is that assessing the quality of those GNN explanations can be very challenging, because there is no real ground truth notion of what an explanation entails in existing graph data sets. And there is also very little work on systematically analyzing the reliability of GNN explainers. So with the team of collaborators and kind of great students, Chirag Agarwal and Owen Quinn, we were recently asked that question more theoretically and start analyzing the behavior of GNN explainers with respect to certain key desirable properties that relate to faithfulness, in the sense of how faithfully an explainer mimics predictions made by the underlying GNN predictor, whether those explanations presented to domain users are really robust to small changes in the input, and that whether they are able to preserve fairness, so that during the process of modeling, auditing the model, any kind of issues related to fairness or lack of fairness can be identified by the model. So we formalized those properties and did a systematic evaluation across state-of-the-art GNN explainers. And so results of that were kind of mixed, I would say. There is first no clear strategy for generating and designing explainability algorithms that tend to perform well across different classes of evaluation metrics and different dimensions of the quality of explainers. And sometimes simple references such as random node features or random edges perform better than methods that were designed in the literature, clearly pointing towards the need that we need robust ways to evaluate the reliability of explanations. And so most recently we asked ourselves whether we can provide some of the initial theoretical bounds on each of those dimensions of GNN explanation quality across the methods, and kind of that's something that we were looking into in the paper, and provide for the community a resource called GraphXAI that can support the rigorous evaluation of state-of-the-art GNN explainers across multiple data sets and domains, in such that it addresses all currently known pitfalls of GNN explanations that can be pointed out by others, related these problems of redundant or non-unique explanations, where there might be multiple different rationales that generate the correct class label. And so one should not then penalize an explainer for finding one of them, or the explainer should find all of them. And sometimes explanations are trivial, and so that's another thing that should be considered, which is what GraphXAI resource does. Okay, so with that, let me wrap up my talk today. I would like to say that I think the future is very bright for the opportunities that exist for geometric deep learning methods, as well as applications in the broad area of precision medicine, where for me there are two big pillars that are really crucial, which is on one end advancing precision medicine questions that are most often driven by research in knowledge graphs, and on the other end advancing the design of effective and safe therapies that is primarily driven by having models that can include various kinds of symmetries, equivariance, and various constraints in the context of molecular data sets to help accelerate a scientific discovery process. I will stop here, happy to take any questions and also follow up with the audience over email. Thank you.
Fantastic. Thank you so much, Marinka, for your amazing talk. We have so many questions in the chat, perhaps too many to cover right now over video, but I'll ask some of the more popular ones, and then others we can follow up on Slack. So some of the more popular questions. The first is about the underlying graphs used in the Shepherd model. And generally, there were a lot of questions about which knowledge graph did you use for pre-training? How do you measure robustness of these model performance with regards to changing the sources or types with the makeup of the prior knowledge that you train on, and so on, along the lines of how do you construct and learn knowledge graphs?
Okay, that's a great question. So first, I would say the precision medicine knowledge graph that I mentioned throughout the talk a few times that we used is called PRIME-KG. It is a knowledge graph that we built in the group over the last 2 years. It's publicly available. So if you go to our lab website or just Google for PRIME-KG, you will find pointers to the paper, to the code base, rigorous evaluations on the quality of the knowledge graph, and also a DOI on the latest version of it. We also provide a simple Python script that allows the community to generate updated versions of PRIME-KG. A big problem that I see in the field for various biomedical knowledge graphs is that it's hard to update them when new data become available. And that is something that was quite important for us, because then we can generate multiple snapshots of the knowledge graph at different points in time, and then do more rigorous evaluations of ML predictions, trying to mitigate the problem of data leakage by taking the knowledge graph that was generated up to biology data or knowledge of biology and medicine up to time t, and then ask the model to make predictions after time t, and evaluate the quality of those predictions, which is more realistically mimics the use of those models. But PRIME-KG would be the starting resource for that. And the Shepherd paper is also something that I'd highly suggest checking out, because it has various evaluations in terms of measuring quality of model performance across different geographic regions, across disease areas, across years of evaluation, and do these splits in kind of very thoughtful way.
Awesome. Thank you, Marinka, for that answer. Perhaps just a very one brief question before we move on to the next section. Someone asked, you mentioned that there is a lot of work on representation learning on small molecular data? Are there particular directions or adaptations that would help move forward your area? For example, considering drug-drug interaction tasks in evaluation.
Yeah, so lots of questions. I think that the part that is particularly exciting relates to interactions between small molecular compounds that the community now knows how to predict their properties quite well, and sometimes be able to rewire or generate new or slightly modified version of them that have better biochemical profiles. But the question then really becomes whether those molecules, when synthesized, will they actually bind to their right therapeutic target in the right cellular tissue, meaning the right cell type, the right tissue, in a safe and effective manner for patients. The big challenge in drug discovery is high attrition rate or high failure rate going from stage 2 to stage 3, where essentially we want to say whether all this work and data that were generated using preclinical models or biochemistry will actually have the effect when we would put it into human patient. So kind of this like really extensive forward lookup and broad generalizability, that's something that I would be very excited about, and think of a small molecular compound in the biological context.
Wonderful. Thank you, Marinka, for your insights and your wisdom. So I know this is a webinar, so we can't see our audience, but let's give Marinka a quiet round of applause. And thank you again so much, Marinka, for your keynote. And now I will hand it over to Yulia.
Hello. We are starting the last spotlight session of the conference. We have once again an amazing line of authors. As usual, the presentation will be 20 minutes each, including questions. So please ask your question either in the Q&A section of the webinar or in the oral discussion channel in the Slack, and we will try to address as many as possible. The first paper tonight is you can have better graph neural network by not training weights at all, finding untrained GNNs tickets. The presenter is Shui Liu. So if you can please share your screen.
Hi, hello. I cannot share my screen.
Give me a second. I thought that I give the necessary. It says that you don't have the necessary rights.
No, I guess not.
Oh, okay. Sorry.
Yeah, it works. Great.
Perfect.
Perfect. Yeah. Yeah. Hi, everyone. My name is Shui Liu. I'm a postdoc researcher in UT Austin now. I'm very glad to present our paper. You can have better graph neural networks by not training weights at all. And yeah, as you can see, I have a lot of friends in this paper. Like, I guess if LG has an award for papers that has the longest author list, I probably will win that award. And yeah, this is joint work done by our colleague in Europe, TUI Eindhoven, University of Twente, and the University of Liverpool, and also our colleague in UT Austin. So the research goal of this paper is actually has shown in the title, like how can we find better graph neural networks without training weights at all, which is kind of counterintuitive. But yeah, I will explain further why we should do that and how we do that. Yeah, so the motivation here, wait one moment. Yeah, the motivation here is like we already know the typical graph neural networks are obtained by updating weights with the gradient distance, which is well known that is cannot go deep, and because of the well-known problems such as over smoothing, over squashing. So here we want to ask a question like, can we find a better graph neural network by not updating the weights at all? So, oh, sorry. So the problem here has been observed by previous art, like the gradient flow or error signal in deep graph neural network is quite poor, as we can see in the in the figure. Like the deeper graph neural networks whose gradient flow is actually quite poor, is non-informative. So updating our weights with such non-informative gradients is quite challenging. So yeah, here is our research question again. Can we find a graph neural network in an alternative way without updating weights? This is a quite challenging questions, and I want to answer this question by the following, divided by the following three research questions. Is it possible to find the untrained graph subnetworks that perform as good as densely trained graph neural network? Because previous studies have shown that it's actually possible to find untrained CNN subnetworks at initialization without changing the weights, which is apparently because of the highly over parameterized property of a graph neural network of a convolutional neural networks. But for a graph neural network, which is usually not that over parameterized, is quite compact compared with the CNN. So it remains unknown if we can find such untrained graph network at initialization. And if the answer of the first question is yes, how small but performant can these untrained GNN subnetworks can be? And because the next question is because we don't update the weights at all. So is there any favorable properties these untrained GNN subnetworks can be? So yeah, here I'm going to introduce our untrained GNN case to solve this problem. So for the people who are not familiar with the untrained, who are not familiar with the subnetworks, a subnetwork is a subset of a neural network whose connection between two layers has a lot of zeros, so it's sparse. And this sparsity is constrained by or learned by a binary mask M. If we multiply the parameters of the GNN by the binary mask, then it will give us a sparse graph neural network where a lot of weights actually are zero. And our optimization problem is here. Like we trying to minimize the loss function of our graph neural network by only optimizing the zero elements in the binary mask. So as we can see, the parameter of our graph neural network is actually fixed throughout training. We only optimize the zero position of the mask. We never change the weight value in the graph neural network. By doing this, we can actually, at the end of optimization, we can have untrained sub GNN subnetworks that can achieve the comparable performance as the densely fully trained network. Yeah, and our method is actually quite simple, quite straightforward. So for at initialization, we randomly initialize the graph neural network, and with the fixed weights, and the more important thing is we assign a score for each fixed weights. So we don't update the weights, but we update the score, and this score is used to initialize or choose which mask we should use. So during the forward pass, we use the edges. We dynamically choose or activate top K weights to fit forward pass based on their the highest scores. And during backward pass, because this masking is not differentiable, we use a straight through estimator to make sure we can update the score during the backward pass. So we're doing this throughout training. We can evolve to a very powerful masking process. As I said here, masking is actually training. And compared with our previous art like untrained neural network and convolutional neural networks, we add two modifications to improve improve the capacity of our untrained GNN subnetworks, which is first we introduce gradually specification schedule, which allows us to gradually specify the dense model to our target model throughout training. So we don't do pruning or specification in one shot. Instead, we do it gradually during training. And the second modification is we introduce non-uniform layer-wise sparsity. Like we allow each layer has their own sparsity level, so instead of using one sparsity for all layers. So these two tricks actually is quite well known for sparse neural network training and the pruning process. And we found that these two tricks actually improve the performance of our untrained GNN tickets a lot. So next I'm going to answer the previous three questions by our experiments. So we conduct experiments on three GN architectures: GCN, GIN, and GAT. And we also evaluate our hypothesis on node level and graph level tasks. We evaluated on 8 common used large scale and small scale datasets. So first, our first answer is we provide a positive answer to our research questions, as it is possible to find matching untrained GNN subnetworks at initialization. So here the x-axis is the model size of two-layer GNN, various GNNs, whose dimension varies from 64 to 128 to 256. So that means the model weight increases as the x-axis increases. So we can say the green lines is fully trained dense GNNs, and the orange lines is our method, and the blue lines is the previous art on untrained CNNs. And we can say if our model is compact, like we only have 64 dimension, it's quite challenging. It's impossible to find such untrained GNN subnetworks. But as we increase the model size, we literally we start to finding much performant untrained GNN subnetworks that can match or even outperform the densely trained GNNs. So yeah, the answer here is we are able to find matching GNN subnetworks at initialization, but under the condition that the model size increases a bit. And we also verify that the existence of such matching GNN subnetworks can be found on both node level tasks and graph level tasks, as we can see here. And next, we are going to answer how small and performant our GNN subnetworks can be. So you can see the x-axis here is the sparsity level of our subnetworks. That means how many connections or weights are actually zero. We can see the green lines are our method, and the black lines are the densely trained network. As we can see, it's quite surprise that we can sparsify the model up to 99% sparsities but we can still match the performance of densely trained network, graph neural networks, which means 99% of weights are actually zero. We can still find a subnetwork on the dense network with really good performance. And note that on large scale datasets like OGBN archive, the matching sparsity, like the sparsity level of subnetwork that can match the densely trained network is relatively low, but we can still find matching graph GNN subnetwork at a high sparsity level, like 70% or 80%. And next, because we obtain our GN subnetworks by not optimizing the weights, so we expect there might be some favorable properties of our untrained GN subnetworks. The first one we investigated is whether we can mitigate the oversmoothing problem, which is a quite notorious drawback limitation of the graph neural networks. As we can see here, the yellow one, like the orange and greens, are two untrained graph neural networks method, and the black solid lines is the densely fully trained GNs. And we can see as our method can preserve the accuracy quite well as GN goes deeper. And even though the accuracy, there's a trend that accuracy goes down, but we can preserve accuracy quite well. To dig deeply into this phenomena, we try to visualize how and why we can mitigate this oversmoothing problem. Here we measure the mean average distance among node representation of our untrained GN subnetworks, which is shown as yellow lines. We can see, compared with the blue lines, which is fully dense GN, fully trained GNs, our MAD, the mean average distance among node representation, is quite distinguishable. That means the node representation learned by masking the weights is actually, it works. It doesn't have a severe oversmoothing problem. And as we can see at the epoch 10, here I have to mention that the graph neural network we choose is 32-layer GCN learned on Clevert dataset. And we can say at the beginning, the last point is I think it's the MAD of the classifier. At the at the beginning of training, like epoch 10, the MAD of the classifier is relatively low, but as we train goes on, actually the MAD of the classifier actually increase a lot. That means our model has the capacity to do classification, which is in stark contrast with the densely trained GNs, where we can say the MAD of the node representation is close to 0 during the whole training time. And beside this, we also visualize the node representation with t-SNE, which is shown, our method is shown on the bottom. We can see compared with the densely trained GNs, we learn actually quite distinguishable node representations. We also try to provide a plausible reason for the trainability of our GN subnetworks. So as we mentioned, the gradient norm of densely trained deep GNs is quite small, as shown in the green lines. But while as long as we're masking the weights and trying to update the weights instead of trying to update the masking score instead of the weights itself, we can see the gradient norm is preserved quite well, which kind of explain the trainability of our masking GN subnetworks. Yeah, and beside the prediction problem, prediction performance, and also the oversmoothing problem, we also find that our untrained GN subnetworks has other better properties, like better out of distribution detection, and it's more robust on feature perturbations and on age perturbations. I will not go into detail about this analysis. For the audience who are interested in this, I encourage you to read our paper. That's all I want to talk about. Let's summarize the main takeaway of our paper. So we provide positive signals that it is possible to find untrained graph GN subnetworks at initialization, like without updating the weight itself, but updating the mask span over the weights. And the sparsity actually goes quite high as 99% of sparsity. That means 99% of connections or weights are actually can be zero. And other good properties, do our method has other good properties? Yes, we have our method can mitigate our smoothing problem. It has also favorable performance on OOD detection and can be more robustness. Yeah, that's all. That's all for my presentation, and feel free to ask any questions.
Thank you so much for the nice presentation. There are a couple of questions in the Q&A session. One from an anonymous attendee. They say, interesting perspective. If you don't train weights, how is GNN now different from traditional graph signal processing method, pure graph convolutions? It seems to me that the proposed method is just a smart way to adjust how the pure graph convolution is applied, which is to consider how much weight to put on the edges. Please correct me if I misunderstood.
Yeah, I think there are some similar good questions, by the way. I think there are some similarities between the traditional graph signal processing and our method. But I mentioned our method is untrained a graph neural network, but actually we're doing optimization, like to choose which connections in the graph neural network actually contribute the most to the loss function of graph neural network. So it's still training, it's still a deep learning problem, but if this is just we change the training ways of updating weights to the updating the mask. So I think the most important thing is the searching space of our graph neural network is constrained by the fixed weights as their initialization, but we are still searching for subnetworks. Hopefully I answered that question.
Thank you so much. Stefan asked, what results do you expect to find by further fine-tuning the sparse lottery ticket models found?
What results do you find by further fine-tuning? Oh, that's a really interesting question, which we haven't tried yet. There is there is one previous work on untrained GNNs. They found that the original one, like the edge pop, they found these untrained subnetworks in convolutional neural network actually cannot be trained to match the to further improve the accuracy. But there's one method called rare gem, which shows they use similar modifications to us, like gradually magnitude pruning and local global sparsity. They actually found the subnetworks can be trained to improve the accuracy further. So yeah, this is quite interesting for us to test if our untrained GNN subnetworks can be trained or not. I will post the results if we have that.
Thank you so much. There are several other questions in the Slack, so I'm going to ask you to follow up on that offline because we are running out of time. But thank you everyone for asking incredible good questions, and thank you so much for the presentation.
Yes, thank you so much for organization. I will answer the offline questions. Thank you.
Perfect. The next paper is influence-based mini-batching for graph neural network, presented by Johannes Gasteiger. Johannes, can you please share your screen?
Hi, yeah. Okay, does this work?
Yes, thank you.
Great. Okay, hello everyone. My name is Johannes Gasteiger. I'm happy to present influence-based mini-batching today, which was work equally done by Chendi Tian and myself. So to start off, let's talk a bit about mini-batching on graph neural networks. Existing methods primarily fall into three categories. One is node-wise sampling. So here you have your output node, and then you sample from all the neighbors of the output node, and you do this recursively. The second category is layer-wise sampling, where you look at all the nodes in your different GNN layers, and then you sample in each layer. this kind of gets rid of the exponential increase of neighbors that you would have in node-wise sampling. And the third category is subgraph sampling. In subgraph sampling, you look at your output nodes and then you sample a meaningful subgraph based on these output nodes. And then you run your GNN on this whole subgraph. Okay, these are all fine methods. So what is wrong with them? I would say the main points that we try to tackle in our work is that the previous methods are mostly done for training. They're rather ill-suited for inference. You can imagine that as you sample your neighbors, some of your output nodes might get neighbors that are suboptimal. And this will hurt your performance down the line. That's one aspect. And the other aspect is that sampling incurs expensive random data accesses. So since sampling could lead to very different nodes in at different times and in different parts of your graph, they will use random data, which is and modern computer architectures are not optimized for this use case. So we propose to create mini batches deterministically based on the influence score. So to use the nodes that are the most important. And this accelerates inference by up to 130 times and training by up to 17 times without a decrease in accuracy. Okay, but let's take a step back first. So to define some things, output nodes are the nodes we want to create outputs for. So predictions in validation, for example, or the nodes we want to calculate the loss from during training. And auxiliary nodes are only used for the inputs. And they're used for the inputs and they define the graph of our batch. Note that an output node in one batch could be an auxiliary node in a different batch. Okay, so we want to create mini batches. How do we do this? Via the influence score. The influence score is essentially the gradient of your output embedding by the input feature. So the gradient of the embedding of an output nodes from the auxiliary node. And why is this a good idea? In our paper, we show in theorem 1 that maximizing the influence minimizes the approximation error. So choosing the nodes with the highest influence score is optimal with respect to this approximation error. Of course, there are some assumptions here on the GNN and what kind of knowledge we have, etc. But this is a good motivation to do this. And how does this work? Okay, the interesting thing here is, I said earlier, we want to maximize the influence score. So this lets us frame it as an optimization problem. So in the optimization problem, we have the influence score, and we want to maximize this. So we sum over all the nodes in our auxiliary set and all the nodes in our output set, and we choose the auxiliary nodes from our nodes so that this is maximized. We call this auxiliary node selection. And then in the outer optimization loop, we sum over all the batches, all the output sets, and we want to maximize the partition. So we want to maximize the sum of influences. We want to choose a partition that maximizes the sum of the influence scores. We call this problem output node partitioning. So we have these two steps here, the auxiliary node selection and the output node partitioning. Now, the influence score depends on the model. So we also approximate the influence score by using personalized PageRank. The reason for this is that many graph neural networks that use a linear aggregation function can converge to PPR if we if we do a layer-wise view, they are a random walk. And then if we increase the number of layers, the random walk would converge to the limit distribution, which is PageRank, and that's not ideal. So it would be over-smoothing. Then to fix this, we can add a restart probability. And if we do that, we get personalized PageRank. So for that reason, we use the influence score. But in practice, you can also use an influence score that is more tailored to your model. Okay, so that's the first step. Now, regarding auxiliary node selection, we have two approaches here that we talk about in our paper. The first one is node-wise selection. Here, we calculate personalized page rank for each output node separately. So we get these kinds of sets of auxiliary nodes. And then in the second step, we merge them. This is nice because it is kind of a worst case optimization. So every node gets a good neighborhood and no node is left behind, so to say. If we relax this a bit, we get batch-wise selection. Here, we calculate page rank for the full set of output nodes all at once. So we consider all the output nodes in one batch, and we get the full set in one step. This is faster, but it has the disadvantage that we're not looking at the worst case anymore. So some nodes might get a lot of neighbors and other nodes might get way too few. That's the first problem. Now let's talk about the second problem, output node partitioning. Here, the main problem is that output node optimal partitioning is intractable. The number of possible partitions increases exponentially, and there is no real way to know a priori which partition is good. So we use a heuristic instead. We say, if there is a high overlap of auxiliary nodes, that is good. And we have a high overlap of auxiliary nodes if the output nodes are nearby. You can easily imagine that if two nodes are nearby, they will probably share some auxiliary nodes. And again, we have two methods that are based on this idea. The first one is distance-based. Here, we already have a measure of proximity. We already have the PPR scores from the auxiliary node selection. So we just use them again and say we have a set of output nodes, and then we merge the output nodes together if they have a high PPR score. So if you look at this graph, in the first step, we put the bottom two nodes together and the two nodes on the right-hand side. And then in the second step, we also put this third node into this batch. So we do this step by step. The second method we have is graph partitioning based. So here we use a standard algorithm, matrix partitioning, to partition the whole graph. And then we look at the output nodes we have, and that way we select which nodes go into which batch. So overall, we have this kind of two-step process. We have the output nodes, and then we partition them in the first step. And in the second step, we select the auxiliary nodes for each batch, and that defines our subgraphs. How does this do in practice? First, we look at inference. So here we have a lot of data. On the x-axis, we have inference time. Note that this is logarithmic scale, so there's a huge difference between different methods. On the y-axis, we have the accuracy. We have 3 rows of different data sets, and we have 3 columns of different methods, of different models that we base everything on. The best methods are on the top left. They're accurate and fast. And as you can see, IBMB is always on the top left. And here we have the 2 variants of IBMB. We have node-wise IBMB, which is based on node-wise auxiliary node, node-wise PPR-based auxiliary node selection, and distance-based partitioning, and with batch-wise, which is based on batch-wise selection and graph partitioning. Every data point here is based on the average of 10 runs, and we do inference on the same pre-trained model. We use the same optimized pipeline for all methods, and we optimized all the hyperparameters of all methods, or all the relevant hyperparameters for all methods. So we try to be as fair as possible here. And as you can see, many sampling-based methods have a bit of an issue during inference, and they suffer quite a bit in terms of accuracy, which is due to the reason I mentioned earlier, that some sampling-based methods get some neighbors that have some output nodes which just get sampled a bad neighborhood. Okay, so this is inference. What about training? So you might immediately, if I say fixed batches, you might immediately say, hey, wait a second, we do stochastic gradient descent. All the theory behind stochastic gradient descent is based on stochasticity, which is true, but we're not the first to find that fixed batches can also work. So what are the reasons for this? Well, first off, we have sparse gradients, unfortunately, which means that we only have some output nodes, so we only see a part of the actual full batch gradient. But adaptive optimization methods like AdaGrad and Adam were made for these sparse gradients. They were created with this motivation, and they can handle this pretty well, fortunately. The second issue you might find is that if you have fixed batches, you might get oscillations. So if you have one batch that covers one aspect and another batch that covers a different aspect, you might get this ping-pong behavior back and forth. But you only get this in normal gradient descent. As soon as you add momentum, the momentum will lead to you going further and further into the center where you actually want to be. So adaptive optimization solves this problem as well. A third problem is not handled well by adaptive optimization. What can happen is that you could have multiple batches that all stem from the same part of your graph. So you take larger and larger steps into the same direction because you are adaptive. To counteract that, and these steps become worse and worse because all your network is now focused on one aspect and performs very, very badly on the rest of the graph. So to counteract this, we propose some batch scheduling methods. Essentially what they do is they optimize the dissimilarity between consecutive batches. Dissimilarity measured in the label distribution. So here we have supervised learning. So we have the output labels, and we can, during training, just say, okay, we want consecutive batches to be as dissimilar as possible. This leads to a traveling salesman problem, unfortunately, but there are good approximations to this, and we can also stochastically sample this. And we find that in the end, if we combine these different methods, we actually get consistent convergence. And we're still left with our advantage of being able to cache mini batches in contiguous memory and being very fast during training when we need to load these mini batches. So what do we observe? We have the same 3 columns of data sets and 3 columns of models here. The x-axis is logarithmic in time. So again, the best methods are on the top left. So we want to be fast and accurate early on. And we can see that influence-based mini-batching, especially the node-wise variant, performs really well and is the best one on almost all data sets. We have this one outlier where Shadow performs well, but Shadow is a bit inconsistent between data sets. Again, this is based on the average between 10 runs on each data set, and we showed the 95% confidence interval in a shade of each color. Now, one interesting thing about IBMB is that it doesn't depend on the overall graph. We only depend on the training set, and we ignore all the other nodes. As you saw earlier, if we only choose the nodes with the highest influence, there can be nodes that are never used. And this we can use for faster training. So in practice, you might often have human labeled data, and human labeled data is very expensive. So then you get very small training sets. And the advantage of node-wise IBMB grows larger as the data set becomes sparser. Not as much as you might hope, but it does become larger. Here you see it compared to cluster GCN and GraphSaint, which are 2 of the strongest baselines we had. We also have a bunch of ablation studies in the paper. I'm only going to show one of those, which is batch scheduling. I mentioned earlier that this whole issue of batch sequences. The 2 approaches we use is the optimal approach, where we just solve the traveling salesman problem. That's what we have in blue. And then we have the sampling approach, where we only myopically look at the current batch and the next batch, and we just choose a next batch that is as dissimilar as possible, given the constraint that we want to look at all batches in one epoch. As you can see, the normal randomly chosen batch has some downward spikes. In particular, at around 70 seconds, you have this downward spike. In the sampling approach, it looks a bit better, like the curve is a bit smoother. It's not perfect, but it's way better. And then with the optimal schedule, we get a very smooth and nice curve. And this is because adaptive optimization kind of smooths over the gradient information over multiple batches. So it works well even if we have very correlated fixed batches, as long as we have a diverse set of batches in a sequence. Okay, so to conclude, influence-based mini-batching, IBMB, is a framework, first of all, a theoretical framework and optimization framework for selecting mini-batches for GNNs. I proposed 2 practical examples of this, and the practical versions accelerate inference by up to 130 times and training by up to 17 times at a similar accuracy as previous methods and as full batch. And we saw that with batch scheduling and adaptive optimization, we can consistently converge and have good training with fixed batches. So this was our work on influence-based mini-batching for graph neural networks. Again, I'm Johannes Gasteiger. This was work equally done by Chen Etienne and supervised by Stefan Günnemann.
Thank you so much for the presentation. There are no questions so far in the Slack, but please continue to ask questions if you have, and I will ask Johannes to keep an eye on the oral discussion channel in case people have any follow-up questions there. Thank you so much once again.
Yeah, thank you. I hope it was clear, and that's why there are no questions.
Definitely clear. The next presentation is based on the paper, The Multi-Orbit Skew Spectrum, Boosting Permutation-Invariant Data Representation, presented by Armando Bellante. Armando, can you please share your screen?
Hi, yes, let me try. Okay, should work.
Thank you, yes.
So, hello everyone, thanks for having us here. I'm Armando Bellante from Politecnico di Milano, and this is a joint work with Martin Plavala from University of Siegen and Alessandro Luongo from the National University of Singapore. Before diving into the talk, let me give a little disclaimer, which is our research fields are quantum computation and quantum informations. So if you have any feedback on this work, or you think we should try something, you have some ideas to share, feel free to reach out either on the Slack or via email right after the talk, whenever. So our project is about embeddings, and an embedding is a function that maps a graph into a vector. Ideally, we would like this embedding to be permutation invariant. It means that if you have 2 graphs that are isomorphic to each other, so if there is a permutation that brings graph G1 to graph G2, then we want our embedding to map the 2 graphs on the same vector. However, building functions that are invariant is kind of easy, right? I mean, you can have a constant function that just returns 1 and you have an invariant. The tough job is completeness, achieving completeness. So if you have a graph that is not permutationally equivalent to the first 2 graphs, right? You want to map it to a different vector, hopefully. However, achieving completeness is not easy, and usually you trade off completeness for computational efficiency. So you still want to achieve a bit of completeness, but you still want your embedding to be computable in efficient time. The main question that we ask is, can we design a permutation invariant embedding unsupervised, so without taking into consideration the data labels, that handle some more complex graph structures? So the question came to our mind looking at graphs like G2 and G1. So if we're looking at G2 and G1, we see that their structure is the same, but if we consider node labels, this node here with label 0 has degree 3 in G2, but it has degree 1 in G1. So for instance, if we are considering anomaly detection on bank transactions, you could have that node 0 is a person here and node 5 is a supermarket. And we want to take this into consideration while learning on those graphs. So we would like ideally to have those graphs mapped on different vectors. And we use group theory to develop such embeddings. Our work is called the multi-orbit skew spectrum of graphs. And so before going into the multi-orbits part, we introduced the concept of skew spectrum of graph. The skew spectrum of graph is a group theoretical embedding proposed by Condor and Bocart in 2008. And the main idea, the key idea here is you take the graph, you take the adjacency matrix of a graph, usually with no self-loops, and you map it to a function. So your graph becomes a function, and the function is defined over the symmetric group and the size of the symmetric group. So Sn, the n is given by the number of nodes. So for a 6x6 matrix, we will have S6. So the function takes an element from S6 and maps it into, outputs a value of your adjacency matrix. For instance, an element of S6 could be the following, where it maps 1 to 5, 2 to 4. But what we are interested in is what this permutation is mapping. Where the permutation is gonna map the last two elements of S6. So where 5 and 6 are gonna be mapped, and they are gonna be mapped in 1 and 3 in this case, right? So the function on this element will return 1, 8, 1, 3, this weight here. You can visualize this function for a 4x4 matrix, for instance, and you see that the domain here is discretized because you have the elements of Sn. The function is constant over a whole subgroup, which is Sn minus 2, because the only relevant part are the last two elements of the permutation. And so what happens is that now you have a function, and this function is representing your graph. The next idea of Condor and Bocart was, okay, now we can use some Fourier properties of these functions. And if you're familiar with signal processing, the idea is basically the idea of a bispectrum. So they investigate the triple correlation of this function, and via, let's say, some function of the function and Fourier transform of this function of the function, they build an invariant. Here, this is an entry of the skew spectrum, and an entry of the skew spectrum is indexed by a group element and an irreducible representation of Sn. And so like those rows are irreducible representation. That's why an entry of the skew spectrum is a matrix, which then we can unroll. Of course, this leads to computational issues because we are gonna query the entries of the skew spectrum for a lot of group elements and a lot of irreps. And also one entry seems to be computationally expensive, right? But here again, the trick is that you can decompose an entry of the skew spectrum using a Fourier transform of the function over the group, via the definition of Fourier transform function over the group, and another function that if you see it as a couple of Fourier transforms, then the computation becomes much easier. And in the end, they show that you only need to compute the skew spectrum for 7 group elements and 4 irreps. And in the end, the skew spectrum costs n to the 6, where n is the number of nodes. But the number of features also depends on the nodes. So what they do is they provide an heuristic, which is a reduced skew spectrum, where they basically cut this matrix here by projecting on some on a subspace of the irreps, and they end up with the most important characteristic of the skew spectrum, with a number of features that is constant, so it doesn't depend on the size of the graph, and it can be computed in n-cube operations, which is reasonable. Let's dive into the generalization to multiple orbits. So what happens with the skew spectrum is we have a graph. We start numbering the nodes of the graph, and we build the adjacency matrix. Now, when we are applying a permutation to this adjacency matrix, what is happening is that we are kind of taking the same graph and starting labeling the nodes from a different index. So they define the function in this way, right? This is iterating over the off-diagonal elements. And what the result is saying here is that the skew spectrum are the same if the function is translated by a permutation. So if you relabel, if you permute these nodes, then the function is going to be the same. But let's consider some node labels. And for the moment, let's encode them in the diagonal, because that's what we originally thought. And that's how we visualized the thing initially. And then we changed notation. So let's encode this into the diagonal. If you really start counting from a different perspective, then of course the diagonal is going to change as well. But the elements of the diagonal are never going to be off diagonal, right? It doesn't make sense that a permutation exchanges a node label with an edge. So you are defining two orbits here. There is one orbit of edges that are permuting between themselves when you apply a permutation. And then there's the second orbit, which are the node labels. So you could actually define two functions, right? One function is defined on the off diagonal and take care of one orbit, and the other function takes care of this orbit here, right? The diagonal itself. But of course, you can also have invalid permutations, right? So like in this case, what is happening here is you're just relabeling the nodes, but the edges are not changing. So here one has degree 0 and here it doesn't. If you leave the functions in this way, then you will not be able to distinguish between valid permutation and invalid permutations. So our key intuition is we need to change the function f, and we make it a vector valued function. If you have k orbits in general, you define it as a function from the permutation group to a vector of k entries. Make it more clear with some example, if you consider a graph with node labels, then you can consider an adjacency matrix and a vector that contains the labels. So the function will have two entries. One entry will concern the edges, and the other entry will concern the node labels. So that finally, when you apply a permutation to your function, the permutation is applied consistently both on the adjacency matrix and on the node labels. And that's the key. The key is the permutation is going to be applied simultaneously on both the orbits. Now you can extend this concept of orbits, right? So for instance, here we only have two orbits, but say that you have some node features. So here X is a matrix where the rows are your nodes and the columns are the features. Of course, it doesn't make sense that a permutation mixes features, right? You can, if you have a data set then it's representing some people, then you have that it doesn't make sense that the height of some people get mixed with the age. That's why you define one orbit per each feature plus one orbit for the adjacency matrix itself. And now you have this vector valued function, which has the adjacency matrix and the other k-1 features. And again, the permutation will act accordingly on all those orbits simultaneously. Then we will have to extend the skew spectrum, but we can handle that. You can also extend it further and go to multigraphs. So if you have a multigraph, you can have, basically you have layers of different edges with different meanings, and you can represent them using different adjacency matrices. What you can do is you define your function where each entry of the function is one entry of this adjacency matrix here. So your function is a vector defined over all the layers. And of course, you can mix like multigraphs and node features and have some bigger functions where you have the layers here and the node features, and the permutation acts simultaneously on all of them. Now that we have extended this function and they are vector valued, what we need to extend the concept of skew spectrum. And we do it by taking the formula that we had before and substituting the inner products between functions with tensor products. So now we have tensor products between functions, but still inner products or matrix products between irreps. what we do is we formally prove that this Q spectrum is permutation-invariant. So that again, if you take two functions such that they are always equal up to a permutation, then the Q spectrum will be equal. And of course, we can formally prove that. And then we also reverse engineer and extend the original proof of the speedup by decomposing this function here, again, in a Fourier transform, where you have a tensor product instead of a normal product, and this other function, which is defined with tensor products. Recombining those two functions for reconstructing the Skew spectrum is not that easy, because you have this weird operation, which denotes tensor products of function, but matrix product of representations. But once you have this decomposition, you can play a bit with Fourier transforms and exploit the fact that the function is constant over some subgroups to maintain the speedups. And so for the complete Q spectrum, we have that we only have like an overhead of roughly k to the third, where k is the number of orbits and n is the number of nodes. And the number of features will depend both on k and n. But we also compute the reduced Q spectrum, where the number of features now is constant, or better, it depends on the structure of the graph. So it's independent of the number of nodes, but it depends on the number of labels and the number of orbits. And what happens is that it's still cubic in the number of nodes and cubic in the number of orbits. Then we present some experiments. And the first experiments that came up to our mind was, okay, it might seem that eigenvalues can also handle label graph if you really represent them in this way, where you encode the labels in the diagonal of a graph of an adjacency matrix. But for instance, we can have this simple example where here you see that from node 2 to node 1, you have a cost of 2. And here from node 2 to node 1, you have a cost of 1. So those two graphs shouldn't be equivalent. However, their eigenvalues are equivalent. But the two orbits reduced Q spectra are different. So the Skew spectrum can shatter those graphs, it can map them to different vectors, but the eigenvalue don't. And same for the singular values. On the same direction, we tried this experiment here, and we created 4 different families of graph. Each of these families composed of 1,000 graph, and so you have 1,000 graph isomorphic to 15A, 1,000 graph isomorphic to 15B, etc. And those graphs are built in a way that those two are permutationally equivalent, up to the edges, and also up to the labels, but not simultaneously. So they have the same set of labels, and they have the same structure, but there is no permutation that maps graphs from these two families, and the same goes in this case. What we compare is our 2-orbit representation, built as we were saying. So one orbit is the adjacency matrix, and one orbit is the node labels, compared against a simple concatenation of the Skew spectra. So we have the reduced Skew spectra on the adjacency matrix, and separately the reduced Skew spectra on the labels. We train a random forest with that and see if we can shatter the families. It is the case that with the 2-orbit reduced Skew spectrum, we managed to distinguish the families, but with the concatenation of the Skew spectra, we cannot. So we cannot distinguish those two graphs, and we cannot distinguish those two graphs. So we only get 2 different vectors. Finally, we also run some experiments on molecular data. Here, the goal was not to challenge the state of the art, but was, again, a comparison against other invariant methods. And so what we did was a task of atomization energy prediction, a regression task, and we compared our 2 orbits representation over the Coulomb matrix of this QM7 dataset against the representation given by the single orbit on the adjacency matrix, the eigenvalues of the Coulomb matrix, including the labels, and the eigenvalue of the Laplacians. When I say, sorry, including the labels, I actually meant including the diagonal of the adjacency matrix, while the single orbit doesn't include that. And so we still see that the 2 orbits Skew spectrum has a better performance. So concluding what we said, we extended the single orbit Skew spectrum to handle multiple orbits. And we proved the invariance, and we managed to maintain the speedups, achieving also like a reduced multi-orbit skew spectrum. The reduced multi-orbit skew spectrum produces a number of features which is independent on the number of nodes, and it's still cubic with respect to the nodes and the number of orbits. So it seems also that the multi-orbit skew spectrum is more complete than a trivial extension of the skew spectrum, which can be done by orbit concatenation, for instance. And in some cases, it seems to perform better than eigenvalues or singular values. And despite its group theory complexity, the fixed amount of features should make it a fairly easy tool for machine learning practitioners. So we plan to extend this work and to release the code of our skew spectrum on GitHub so that it's available to everyone. And so that's the end of the talk. I'm very glad to reply to your question or even take them offline. Thank you for listening.
Thank you so much. There are no questions so far, but keep an eye because people tend to write a question a bit later. Thank you everyone for all the wonderful presentation today. And now I will hand it over to Andrea for our sponsor keynotes. Andrea.
Hello, everybody. Good morning, good afternoon, good evening, wherever you are. Yeah, this is the last of our talk before the closing remarks, and we're finishing on a very strong note. We have a talk from our sponsor, Pfizer, one of our gold sponsors, without which this whole conference wouldn't have been possible, or our tools, and also especially our reviewer awards were made possible by our generous sponsors. And I'm very happy to have the chance to introduce our speaker, Djork-Arné Clevert. I hope I got it sort of right. He has a background in computer science and did his doctorate on machine learning for computational biology. In 2022, he accepted a global role as a VP, head of machine learning research with Pfizer Research. And prior to that, he was for several years at Bayer, where he became a director, head of machine learning in 2019. He was a senior research scientist at the Sepp Hochreiter Lab, where he was a co-PI in several large projects with pharma industry. He authored over 60 research articles, scientific reviews, and book chapters with more than 9,000 citations, and strongly contributed to open source software. And my personal favorite was the ELU paper, which I know was essential to getting some of our graph learning forward and making some of our GNN models work. Without further ado, I'll pass it on to our speaker. I'm very excited and can't wait to hear the talk.
Oh, great. Thanks a lot for the very nice introduction. So give me a chance, a second. I have to share my screen and let me check. I think this one should work. Is something coming up?
Yeah, we can see your slides.
Oh, cool. Yeah, great. Thanks a lot. Yeah, what can I say? So I have the pleasure to give a sponsored keynote. So, you know, when my management asked me if I can give the keynote on this kind of conference, I was a little bit like shocked for the first moment, because honestly, I mean, even if I have done a lot of things in the field of machine learning for drug discovery, I'm not as one of kind of guys that have a great track when it comes to representation learning. So, but nonetheless, I thought it would be a good opportunity to talk to you guys and to pitch you a little bit like what you can do with machine learning and drug discovery. There's a lots of foods for thoughts maybe in between. There's cool project, maybe also some kind of nice graph learning approaches that I will present. But like the main idea for here, the main reason why I wanted to do this is actually like I want to convince you that you should take your knowledge, go to pharmaceutical research or biomedical research, whatever it is, really apply those skills that you have in this context. It's a very rewarding field to work with. You're doing something very meaningful. that is relevant, that is having always like has high novelty always. It's so moving forward so fast, this field better. And it's also one of those kind of fields where you have lots of data available. And so we are machine learning guys, we are always looking for data. And so that's now a little bit now the start where I want to do. Okay, so the talk for today is graph representation learning for drug discovery. And now, oh, that's not working. Ah, yeah, and here, maybe let's setting the scene. So this is a completely unbranded talk because, you know, I moved from Bayer September this year to Pfizer. And lots of the work that I have done over the last 7 years with my former group at Bayer is context of this context of this talk here. And so far, I thought it would not appropriate to brand here something. So the credit actually for the work that I would present here also goes to my fantastic former group. And I hope that a couple of guys are in the talk here. So shout out them to them, very happy. Thank you, it was a pleasure to work with you. Now, since October this year, I've been appointed at head of machine learning research at Pfizer. And I promise this is a little bit of advertisement that I have to do here. So I'm currently recruiting for a team in Cambridge in US and in Berlin, Germany. So, and if you have some kind of interest in and learn a little bit about biology, machine learning, drug discovery, then we still have a little bit of place for the one or the other unicorn in the group. So please consider to contact us, reach out for us. And there is, besides the team is already like very nice completed. There are a couple of faces from my former team that joined me, but also a couple of new faces. So looking forward very much to work with them. Okay, so now setting a little bit the context also, what is the difference very often between drug discovery, drug development? So typically the drug discovery process is the early part of the drug of the full R&D process in pharmaceutical research. So you start with a target identification where you're trying to identify an association between a disease and a target, a protein or whatever. Then you go and hand over to the target to hit. That is the phase where you're trying to develop a modality that can hit the target. It's not really clear. It can be a very weak signal, but it's something that actually binds to it or that's modulating the target a little bit. Then in the next step, you're trying to further optimize your hit towards that this is something that is having better potency, may becoming more selective, or so on. And the next step in the lead optimization phase, then you're trying to remove some kind of maybe solubility issues, or if they're coming genotoxicity effects. And then you hand it over into the preclinical phase. And after 5 to 6 years roughly, and after having already invested $500 million US, you see that 2/3 of all projects fail and do not survive the preclinical studies. So attrition rates are super high. On the right-hand side, then we have the drug development project. That is everything that has to do with developing a drug, bring it to the market, making sure that it's safe. So you propagate it through different kinds of phases until it's finally submitted. That is something I will not explain. It's for sure a very, very interesting topic where you can do lots of machine learning. But on the left-hand side, we have large-scale data. On the right-hand side, we have very expensive but small-scale data. I should maybe also acknowledge here the pictures that I took from my friend from Relation Therapeutics. Very nice. Thank you very much for making this kind of nice image here. So a little bit to the background. So one of the main horses that you always would use when you work in the pharmaceutical industry is this typical Skew modeling. So you want to identify something, what the chemical is doing, some kind of oracle that can predict if this molecule is maybe active or inactive, if it's toxic or not toxic, if it's solvable or not, how lipophysitic is it, all these kind of questions that you want to ask. Modeling this kind of project is called either bioactivity modeling or ARTME modeling. The ARTME is like giving you some kind of information of the absorption, the distribution, the metabolism, the extraction, and also the toxicity of the compound. So even though that is a field that has been heavily focus of research since almost 60 years, there's still a strong need for improvement necessary. And that was also basically our first project when we started it by how we used it. That is like our 2017 or something like 18. We built our first graph convolution neural network for multitask prediction of FISCAM properties. And what you can see here, I mean, I don't explain the graph convolution any longer, but what was nice, so by a biggest problem was actually like coming up with a good task grouping. So which kind of task can we put together that bring statistical strength and improve the predictions. The nice thing on the right-hand side is it like what you see, what kind of improvement you can bring to the by coming with the right appropriate model. And so can you see the pointer? Yeah, okay. So to be a little bit clear, so that is the predictive performance of the new graph convolutional model that we have developed. Having a model that is coming with such an R square in a regression task that is almost in the range of an in silico assay. That means that the predictive performance of the model is within the error bars of the experimental error of the assay. So, and another nice thing is it like very often we are talking about the problem of out of distribution or how well does those models then generalize. So therefore we have used the model to predict data that was from Bayer crop science, but never part or was part of the training. So completely independent data, different kinds of molecules and so on. And nonetheless, the model performed generalized so well that it's even those data could be explained very well. So, but if you are having this kind of discussions with a medicinal chemist, then a medicinal chemist also very often wants to know what is the model doing or what is the part that makes the model believe that something is solvable or not. And therefore, we have published last year at ICML a way how we improved this molecular graph convolution network explainability by including autonormality and sparsity. So, and now if we propagate now the thing into a couple of graph convolution layer, and before we enter the global average pooling layer where we aggregate across the node embeddings, and then we pass it into the fully connected layer, then we do our predictions. So if we now take a look at the weights of the baseline on this side, on the left-hand side, then you see that those the weights for the task are not very selective. So it's not that they are really coming up with a clear sparse distribution. They are like every weight is coming up and aggregated a bit. That is not a very nice scenario if you want to expect some kind of explainability. So therefore, we use the Gini regularizer. So that was Florian and Ryan to improve sparseness constraint that we wanted to come up with weights that are specific to certain tasks. And that is a nice feature. It was included. And on the other hand, if you take a look in the last layer of the graph convolution neural network and take a look at the embeddings, then you see in the upper left triangular there that the code of the embedding is not very sparse. It's not a sparse code. So it means that the network is not learning this little molecular concept that are actually responsible if you want to make it explainable. And therefore, we included here also by an algorithm that called BRO, batch representation autonormalization, that is borrowing concepts from quantum chemistry, like about molecular orbitals, where you want to represent those by the linear combinations of atoms, atomic orbitals, and make it sure that the embedding become linear independently. And if you can compare those similarities also between those two embeddings, then you can see that the model has been now much sparser, and sparsity helps there to explain it also. So now in the next step, we Florian and Ryan set up a query and asked our medicinal, the medicinal chemist at Bayer at that time. So now, what is, for example, the site that drives the low solubility of this molecule, showing the molecule in the top left here and some kind of explanation by showing this kind of class contribution maps. What you see here is it like the medicinal chemist then was ranking it. You can here was checking the response count, and what clear was that always bring the sparsity or autonormality to the addition to the to the class attribution maps helped to make this satisfy the medicinal chemist. But on the other hand, we also see just including explainability is not really something that helped. We had to also to sacrifice a little bit on the model performance. So some work that's done a little bit in a different context was also presented here by Tuan on Friday in the poster session, that Tuan wanted to build graph neural networks for learning biomolecular structures really on large scale and making this computational efficiently. So there's lots of evidence there that 3D GNN for point clouds are performing better because they are extracting more meaningful representation that can be used for downstream tasks because they are just including the structural and geometric information. So, but most of the 3D GNNs currently, they only operate on rotational invariant features. And Tuan's idea was, why should we constrict ourselves or restrict ourselves only on this rotational invariant feature? It would be nicer to include rotational equivariant features, but having also a low computational footprint. So he implemented this by additional attention algorithms on the scalar features and created those vector features only as a rank 1 scalar and tensors as vectors. So that is basically the classical message passing protocol, and you see here, like for each atom node, the vector representation, the feature presentation. He has benchmarked this also on the atom 3 benchmark data set for protein structure ranking and RNA structure ranking. And it's not a clear picture that this model outperforms immediately all other competitors, but out of 5 from 7 tasks, it's doing this at least. And it's also much more computational efficiency, also with respect to the numbers of parameters that we use. So for any further discussion or interest in this, I highly refer you to Tuan. He's happy to explain this more in detail. Okay, but there is much more. The diversity of data and the drug discovery universe is extremely high. So and all those kind of data sets are to some degree also interconnected. So if you, for example, receive high content imaging screens, then those images, then those are coming from perturbation of chemical molecules, or they're coming from a genetic perturbation where you knock out a certain gene. That can be linked to a SNP, also like a single nucleotide polymorphism. On the other hand, maybe you see also some kind of mass spec data, whatever is or single cell sequencing data. So there's so much data, and one key thing that we need for drug discovery is smart representations for those kind of data. And that is also how we started to work really in the field. Now, and I can already hear you shouting now in the background, hey, you're on a graph representation learning conference here, and why are you presenting some kind of encoder architectures that are using sequence-to-sequence models? But and there is a lot on discussion also between people if you only take the topological map of the graph and compare to the performance of your learner representation only on this very simple SMILES notation of the molecule, then you basically don't see a very, very, very big performance between those kind of representation you want to use. And so what we wanted to do here, we wanted in our work, we wanted to learn a very information-rich representation that's coming with a fixed size, that is continuous, of course, and that is also decodable, that we can also reconstruct to the molecule again. And what you can do here, you can represent now a molecule in form of a SMILES. And since this is not a canonical representation of the SMILES, you can always translate the smiles in this task to its canonical form. The canonical form is a unique representation for the smiles. And therefore, those molecules, those representation has to learn something, how to describe the grammar in the smiles, and not only just memorizing the semantics of the string. So that was a very powerful representation. And we used this for many molecular representations in drug discovery. So first of all, we tested it, how those models are during training between this kind of translation task, how well it's due, how well the translation task is suited in order to, for example, predict lipophilicity or aims in classification. And when you can see here that making a very simple translation task, so translating it only from the canonical to the canonical, so it does not have to learn something about the semantics, so then just memorize everything, then you see that the network is not doing this very well because the downstream performance of the prediction task is very poor. While if you translate it between the smiles and the canonical smiles, network has to learn much more about the meaning of the structure. That's the representation, and afterwards it's much more suited for downstream application. We tested this also compared to graph convolution neural network or classical ECFP fingerprints, and it's not so that you will immediately outperform all the other algorithms, but it's like at least on par, or in many cases it's also a little bit better, especially if you have if you are in the low data regime. But one beauty of this kind of project is it now that you can do multi-objective molecular optimization, because you can now encode a molecule in this Latin space. And since this is a continuous space and where you can also sample from, then you can slightly change the descriptor a little bit by going an epsilon close step in an arbitrary direction. And then you can decode it again and get a new molecule. And certain properties of the molecules are still there. So now we made a few experiments where where Robin and Florian was trying to optimize a molecule with respect to binding against two different targets. Based on EGFR, for example, and also including other objectives like solubility, metabolic stability, and so on. So, and that was done in a very, very simple algorithm. It was a particle swarm optimizer. So, but nonetheless, we have benchmarked it also again organ that is like a generative adversarial network against the junction tree variation autoencoder and a graph convolutional policy network. And what you see here, in most cases, it's outperformed the other algorithms, like when it, for certain property, if you, for example, see the log P. But the nicest thing is that you can do that much faster. You can do that in 7 minutes or 10 minutes compared to organ or junction tree that takes day, or graph convolutional policy network 8 hours. So it's super fast, and that's what we wanted to have. Okay, since data is interconnected in pharmaceutical or in drug discovery, we wanted to build also something that is conditional on the biology. So we wanted to bridge thereby the gap between chemical and biological spaces. And what we have used there is the nice principle that you have very high throughput screens, where you, for example, take in high content imaging, where you observe certain cells under the microscope, while they were perturbated with certain chemical structures. Since the cells are then stained with different kinds of dyes, and each dye is staining a certain molecular compartment in the cell, you can see from the settled small differences, maybe what kind of mode of action the compound is hitting or not. On the other hand, you can also have large-scale transcriptomic data, where you have a transcriptomic readout and see how the genes are changing, the gene expression is changing after the chemical perturbation was done. So that is then here again a classical generative adversarial network, basically, where you encode a molecule into or a starting molecule into an embedding, and that is like the not optimized scaffold where we start from. Then you have this generative adversarial network that is then all conditioned on the information that we get from the from additional screens, can now optimize the scaffold and then decode it to a new molecule. That is works that we have published in Nature Communication and Digital Discovery recently. And what is now very cool is that you now can take a genetic perturbation. So you knock out a gene, you take an image of the cell painting, so it was never part of the data because it's now a genetic perturbation, okay? Then you stick that into a generative adversarial network and decode it. And that's what we have done for multiple genes here. And it's super highly significant. What you see there was that is the enriched scaffold that is part of many of those molecules that were generated. And then we took a look, what is the known closest inhibitor in the chemical space in the tiny motor similarity to the enriched scaffold. And that was never part of the training. And you see that we can generate an antagonist exactly for the right knockout. And we have done this for breast cancer 1 and also for NF-kappa beta 1. And also it's super cool. That opens up the space for doing complete different way how we want to do a molecular optimization in the future. Okay, but if we have this kind of molecular representation, we can also try to learn or to solve completely different kinds of problems. In this case, for example, a couple of inverse problems. If you have a chemical representation, ECFP, for example, that's extended connectivity fingerprints, it's a random walk to the molecule, and you describe the molecule by a subset of fragments that are occurring in it. A standard representation is that for computational chemists, how to describe molecules. And you want to inverse from those hashed fingerprint now the molecular structure. That was something that was always considered to be uninvertible due to the combinational, to the fast amount of combination that you can generate therefrom. On the other hand, we have in all those papers, we have molecular depiction of molecules, and we don't know what is the graph. It's not a readable, it's not a clear machine learning image. So we want to deduce from the picture of the molecule. So what is the molecular structure behind it? Or if you want to do structure elucidation, then you have some kind of MNR shifts profiles, and you want to understand what is the molecule that is generating those kind of profiles. And that is something that we can also do now. So it's super simple. We have this kind of fixed size encoder, and the only thing that we have to do from that is that we are just like replacing the encoder and learn this thing from the scratch, only now to do the mapping to the decoder from the ECFP fingerprints to the CDD, that is the Latin representation. And since the decoder is already pre-trained on completely independent data, now we can do the translation. And we have done that for different kinds of folding graphs of ECFPs. And it was astonishing because you can almost reconstruct up to 64% of your molecules correctly from those kind of folded fingerprints. And that has some serious effects on how molecules are exchanged in pharmaceutical industry. Because before it, people always thought that you can easily exchange those molecules and no one can understand what is the chemical structure behind that. Another approach is this inverse molecular depiction. Here we have the problem that you can see that the image contains lots of information about the bonds, how the image is lying in the image plane or not, if it's perturbating it or it's backward directed. So, but on the other hand, there is also a lot of variation how those molecules are drawn. So sometimes explicitly bonds are drawn, sometimes like carbons are, or oxygen, super atoms or super molecules are superposed. So or the chirality is also denoted. So here again, we can now learn this kind of network to map the input image from the image to the canonical smiles, and that works also very well with up to accuracies to almost 90% compared to many other state-of-the-art of the algorithms which just completely failed. Okay, so but that is something that's now stopped. Now a few more words regarding actually the learning graph level representation. So since we have shown this kind of approach now for smiles, we thought it would be also super good to do this action on the graph level. So to learn a graph level that should be, again, information rich, have a fixed size, is continuous, and is decodable. But if you want to do this on a graph, then you immediately run into the problem that graphs are permutation-invariant. So if you permutate the node order, then you can get basically the two same graphs, but like from the adjacency matrix of the nodes, it's not the same. So therefore, we wanted to exploit this concept that is the same, and we wanted to learn a permutation-invariant embedding. That is like if you have two graphs and you permutate them, that you can project them in the same pattern space, in the same point in the space. And if you then decode them to the molecule, then you run into the problem over again that the reconstruction of the node of the autoencoder is still dependent on the order of the permutation of the graph. So therefore, Robin has developed a super nice approach that can be also generalized to many other group-wise actions. He had published this algorithm last year at NeurIPS, and he learned in this kind of way how to learn and to encode a graph in a permutation-invariant embedding. Therefore, it can be encoded to something like a canonical ordered graph. And simultaneously, he's learning some kind of he's learning to predict the permutation matrix. So if you then apply the permutation matrix on the canonical ordered graph and permute the graph, that you can get the original graph back. So now everything is completely differentiable. It's like completely can be learned end to end. And you have a very clear objective what to do. So he has tried this out on many downstream tasks. So for example, for graph classification, and you also see compared to ECFP fingerprints also, it's clearly improves the predictive performance for classification or regression. It's also a nice tool that you can now use for graph generation. So left-hand side, you see as the original graph, you embed it, and then you can sample from it, you get different kinds of conformations of the graph of them. And it can be also used for graph clustering. So here different kinds of graph family were encoded, like binomial graph, Bababasi, geometric, power law, distributed, all these kind of graph families, and then learned on these graphs. He learned the t-SNE embedding was shown, and you see that those graphs really cluster nicely together. The different kinds of graph families are, well, different kinds of graph families are separate from each other. Also shown here is like that the embedding that's learned also makes sense. So if you take the graph editing distance into account, and that you see that points that have a very graphs, which are graph editing, large graph editing distance, also show up to have higher Euclidean distance in this Latin space. So, and last but not least, there's a very nice property. I think that is now the graph interpolation, what Robin has also done, according to my knowledge, the first time. So if you embed two molecules or two graphs in this Latin space, and you see in here, for example, the black lines are lines that are connections that are edges that are occur in the end on the start graph, while the red ones are those ones that only occurs in the start graph and has to be removed until in order to go to the end graph. So, and if you then continuously interpolate this one, then you see that the network then learns how to remove or can remove and the kind of edges that is that's necessary in order to interpolate between those two graphs. So that's already now the conclusion. I hope I have a few minutes left for a discussion then afterwards. So I hope that I have you a little bit now on the hook. So we presented a few ways how we use unsupervised learning, and also and that showed that these can really learn meaningful representations that can be used to optimize molecules under different kind of multiparametric objectives. We showed you that these kind of approaches can be used to generate for generative chemistry that bridge the gap between different kinds of morphological spaces or transcriptomic spaces and chemistry, and also showed a couple of approaches where you can solve those where we can solve molecular inverse problems using this kind of approaches. On the other hand, we also proposed here a new unsupervised learning approach to extract graph level representation, where we have now this distinct and tangled representation, where one is the permutation-invariant part encoding the graph, and the permutation-equivariant part that is learning the permuter or the permutation matrix that can be to finally together reconstruct the full graph. Yeah, future work is definitely will take a deeper look into the generative aspects of those new frameworks. And with that, I finally have to give you the small acknowledgement. So first of all, grades. Thanks a lot for my former team at Bayer. Hello to my new team at Pfizer. Pleasure to work with you. Looking forward to having very, very good collaboration. And I also want to acknowledge the European Union for giving me the funding for the AIDD project and the PhD students that were working with me, and also for my other academic collaborators. And with that, thank you for your attention. Happy to take any questions. And if it's only me and a few more minutes until you really want to go to the close marks, I don't take it serious if you don't ask me something.
Thank you so much for a great talk. We'll wait for a sec because I think from what I saw, it takes a bit to formulate the questions from the audience side. But maybe in the meantime, because I worked a bit on drug discovery, and I really appreciate when I hear like more general insights from somebody who sees more of the field. So I was wondering, from your experience, which part of the GNN architecture or pipeline do you think is the least robust, or the one we should focus more on to make it more useful for the drug discovery problems?
Which part of the GNN architecture that we are presenting it today, right now, or what in general?
In general.
Oh man, that is so the problem is always like you have to make the permutation matrix very, very sparse in order, because there is not this kind of okay, let me find. The arc sort is not really differentiable. So you need to take the soft sort in order to make it differentiable. But that brings the problem that the permutation matrix that you're learning is not like always 0 or 1. So you have to work on that to make it a little bit more clearer. That was for our part a big problem. So therefore, Robin constrains this by putting some kind of additional entropy loss on it. But that helps. But of course, that could be probably improved as well.
Okay, thank you so much. I see we have a shy audience, and I guess everything was very clear, so we don't have any more questions for now.
Okay.
Oh, maybe, yeah, okay. We actually got a question, oh, 2 questions. Okay, so my few minutes were enough to formulate. So one question from Chaitanya: there is much excitement in the GNN community, including himself, into GNNs advancing drug discovery. Could you talk about any public success stories of GNNs here?
I cannot tell you really of any success stories so far, because the problem also with this GNNs and the drug discovery success stories, there's like 6 years at least to 12 years. So it's a very, very, very delayed reward that you can see if something is really working at the end. And many of those approaches that you see where methods are looking appealing on the first glimpse, after a while they realized that they did not perform so well. So I'm not aware of any breakthrough or success stories on GNNs, like at least not for my time when I was at Bayer, nor I have to think if I'm actually disclosing secret information. No, it's
Okay, we'll keep our ears open and hope to hear about some success stories soon. If you have some more time, I have some more questions. Sorry?
That is why we need you guys, okay, for those success stories.
Yeah, I think we had a lot of people working on drug discovery, and quite a few posters. So yeah, hopefully this will become fruitful soon.
Yeah,
On to
I
the
hope.
next question.
Oh.
No, go ahead.
No, I thought if we have no other questions left, then I'd go with mine. But yeah, my comment now would have been we definitely have many people here in the groups that is organizing the Learning Graphs conference that are directly working on molecule applications, and not only molecule applications, but drug discovery applications. So we definitely hope that we can make some contributions there and help you guys out.
Yes, I hope so too. And there are different kinds of contributions. So when people also want to reach out and collaborate with industry partners, so the Cambridge site is not so far actually, within walking distance. You can come by and visit us, and we can do cool things maybe together. So it's like there's a few things where I always believe it's a big advantage to doing this kind of research in pharmaceuticals in a pharmaceutical setting. So it's just like we are very close to the labs. We can get the things very easily tested. We have extremely large data repositories where we know already what kind of certain properties molecules must have or no. And that is something, combining this together, I think, could be a very interesting way forward for collaboration. But be prepared, you will not get the data. That's a problem. You can only get it from inside.
We have felt this data scarcity at times, so we are aware.
Do we have a bit more time for some more questions? I see they're starting to pour in. You can stop me whenever you think we should wrap up. But the next one is, what is the impact, importance of explainability, interpretability of GNNs in the drug design pipeline?
Yeah, that's a good point. So, so there are two ways always. So yes, it makes things super important to have a model explainable if you want to discuss finding with a chemist. But if we can think about like what might be the model, how drug discovery will be in 5 or 10 years, I think we will have completely in silico pipelines where lots of things were run and then just like completely synthesized. And in between that, I really don't believe that human beings will visually check if something makes sense or not. So it's just like too much data. People cannot take a look at it. So therefore, I believe if this is going to fly on the long-term perspective, I think explainability is something that I believe can be neglected as long it's sacrificing the predictive performance of the models. If it's at a certain point at a stage where you can make things explainable, maybe it's a little bit more computationally expensive, but you don't sacrifice performance for it, then it's okay. Then everyone will be happy. But yeah.
Thank you so much for sharing your thoughts. We have, so a more general question on what advice would you have for computer scientists, machine learners who dive into the real world drug discovery field? How did you bridge the background required in biology, chemistry? I think this is something a lot of us are wondering about, especially when starting in the field.
Don't be shy, just do it. That's the best. That is actually the best advice that I can give you. So, as computer science, if you have some kind of natural curiosity about these kind of more, that is not a hard process. Biology is nothing like that's 0 or 1, so it's like a little bit more fuzzy. But it's like there are multiple solutions for this kind of stuff. But if you always reach out to those guys, read with, talk with them, trying to at least learn a common understanding, then you can do there lots of things. So, I mean, for me, for example, from my background, I never had studied chemistry. So the only chemistry lectures that I had was at a university, and it was like exactly like four hours a week or something, like for one semester. So that is like, and nonetheless, to some degree now, you can train networks to understand something about chemistry. So isn't it something completely cool that as an outsider from the field, you suddenly get a tool that you can work and use and go to the expert and say, hey, look, that is the way we can do something. I think that is incredible. It's a fantastic time now to go to those domain experts and discuss their problems with them, and they are grateful. They really know that there is something bigger is coming, and everyone is a little bit like, yeah, do we miss something? No, we should not do it. Or I don't know. It's a really, people are now interested in what we are doing.
Thank you for the encouraging words. We have a few more questions, I think, on the VAE for graphs that you presented. I think, yeah, could you elaborate further on how you implemented the permutation invariants?
That is something I honestly, I would refer like going a little bit to the NeurIPS paper. It's a little bit more than just like the permuter box that I have. It involves a couple of different kinds of attention layers. The transformer is also involved there. Also the way how it's been optimized. It's like, yeah, it looks nice, but in reality, it's a beast.
I think we see more and more bits in machine learning. And another question also from Simon. Do you think your methods can be used to model the whole process from GWAS to drugs? Also incorporating single cell data. Are you excited about any particular approaches to this problem?
Oh yeah, I mean, yeah, that is, with single cell sequencing data, that is a problem class for its own, I would say. Zero inflated and was coming with other particularities that brings makes learning maybe not so easy. But yes, definitely, that is getting all these kind of data sources together. It is something that we have to do in the future to include it. Yeah, but we have not worked on this so far.
Okay, and thank you so much for all the answers so far. We have one last question. Given the super long pipeline of drug discovery, is there a systematic way to build intermediate targets for machine learning?
Intermediate targets. I don't know what that could be. There are these intermediate targets, what you can do, these simpler models where you predict certain properties. I think that is not something that takes 7 years or 10 years. That is something that can be done in building this kind of model is a couple of weeks work, and then people can use it and roll it out. And the good thing is that, like, since there are continuous influx on data on the assays, you can always validate it on the fly. So that is something like, but on the drug discovery process, that's why I'm always talking about drug discovery. There's like this horizon of this 5 years. So there's lots of things that you can check. But if you are setting this in a large industrial context, so then it's always like, this is a marginal contribution to the pipeline. So at the end, we have to bring a drug to the submission. And everything that we do before, it's just like a gigantic investment that in 99 or 95% of all cases always fails. So therefore, my belief is we can hope that we can skew a little bit distribution, that we increase the chances of making something more likely that it comes to market. That is already a good thing. So where will we in 5 years? I don't know. But right now, that is everything that we can offer. But that is still something that is very valuable for the community, for the drug discovery people in the field.
Thank you so much for your thoughts. And I realize I stand corrected. I have some more questions. Do we still have time for a few more?
I'm not the organizer.
Okay, but yeah, it's your time. So if you're still available, I will shoot away. I think I wrote in quite a few of my papers that the chemical space is enormous, and we get a question on how important it is to explore the unknown chemical space.
So the chemical space is gigantic. People are always saying something to the 10 to the power 64 or something like that. At the end, I also hear many chemists that they say that it's just like a chemical space based on the combinatorial of synthesis box that they build. So is it a real space that will be a drug-like space? I don't know. I'm not a chemist. So, but exploring this kind of dark corners or dark areas of the Latin space where we don't have matter so far, yeah, that's something definitely of interest. But again, so I think we have something like the druggable genome is something like 2,000 genes or something like that, maybe a little bit more. So, so we have a couple of more genes or targets to hit. So we have to do that for sure. But which direction? That is something where you have to go in close discussions with biologists that are doing the target identification and chemists that really have an understanding if something can be druggable or not. But we have seen so many things over the last years, what has been druggable and what not. So I believe with the advent of this kind of all new modalities that we get, like coming from mRNA vaccines or to getting proteins, whatever it will be, cell therapy. I mean, there are so many opportunities how we can think, how we can cure people in the future. That is something where we maybe chemical space is super important, but on the long term, we really should think about these other modalities.
Awesome, thank you so much. I think you already touched upon parts of the next question, but maybe you have some further thoughts on. Can you give examples on how GNNs can help speed up the drug discovery process?
How genetics?
How graph neural networks, how graph representation learning in general, I would assume.
Yeah, so I mean, you can envision it's like, for example, if you take a graph neural network to predict like the protonation state of the residuals, that is be a very, very important task to then do a better protein preparation that and then used for FFPE calculations. If you can do this much faster, then you get better structural based design. There's lots of opportunities. I mean, it's like you just have to take a hood under the drug discovery process and anywhere, and you will immediately see, oh, that could be a good application for doing something. So that is people should really try to work closer with people in the lab set together to get a sense for that.
Thank you so much. I think this was our last question. This has been very insightful. I'm so happy to have attended this, and thank you so much for taking the time for this talk. I will now pass on to Johannes, who I think has some closing remarks ready.
Thank you very much. Have a very, very nice evening. Thanks a lot for the invitation also and for the cool discussion. I enjoyed it.
Thank you.
Oh,
Thanks again.
Okay, then, yeah, this was another fantastic talk. I mean, we already had 4 other keynotes, and now this is our 5th one to conclude. But well, we wanted to initially conclude at 3, so I think we will stick with that plan because some people are waiting for the best paper announcements, and yeah, the best paper announcements. I'm sure that some people don't want to miss them, and in the meantime, I have this fantastic slide to share here that I think some people will also appreciate, because as we already said a few times, like really without these sponsors, the Learning on Graphs conference could not have happened. And yeah, let's read the text here real quick. We will be back soon. We will be back in about 5 minutes, and then we will conclude with our closing remarks. Yes, be right back, everyone. So here we are. Welcome back, everyone. And am I very happy to do the closing remarks? I mean, yes, I am, but it's also a little bit sad that the Learning on Graphs conference is over, but I think it was a fantastic time, and many things, I have to say, went much better than I expected, and I think also a lot of the other organizers. Like, it's just so amazing how many people we had in Gather Town and interacting with each other. I think that I went to many conferences that were virtual and they Gather Towns, and I think in none of the virtual conferences in a single room or in a single spot I saw so many people. Like the density of people was never as high. But anyway, we had this program here. To maybe quickly recap, we had these 5 awesome keynotes, the tutorials where people spent 3 hours or prepared 3 hours of material together with code, where you could really learn a lot. I know that I learned a lot from the neural algorithmic reasoning and from the graph rewiring. Those were fantastic. We had new keynotes that were never presented before anywhere else. Like often we have these talks that were given many times before, but here you also got something very fresh many times, and I'm very happy about that. Also, how the authors did the orals. I mean, I went to some conferences already, and I think oftentimes the orals aren't that well prepared. But here I was extremely happy with what the authors did, and yeah, of course. We have to not only thank the authors from these orals, but we have to thank all the authors that submitted to the Learning on Graphs conference, that engaged in the awesome discussions during the review process, and that presented also their posters in these 2 poster sessions. And especially in the first poster session, it was amazing to me how many people attended it and how many people interacted there, talked with each other. And yeah, so for me, I can clearly draw the statement that this was amazing, this was fantastic, and I hope some of you can take away the same conclusion, and I hope some of you also learned as much as I did from this conference, because clearly there was a lot of material that was new to me and a lot that I could learn. All right, but we don't only want to look at what we did so far. Let's now also come to something new that we have not announced yet, and these are the best papers, because we have this year 2 best paper awards, and they are chosen out of our 12 orals. And yeah, I mean, I want to make it very exciting, but I'm not sure how to make it more exciting. I'm just excited to finally tell you. And the first best paper is "You can have better graph neural networks by not training weights at all, finding untrained GNNs tickets." And this work has been presented here in the oral as well. So you can also find the stream and go back and watch the oral of this paper, and also, of course, feel free to reach out to the authors. I'm sure they would be happy to chat about it more beyond what they already discussed in the oral session and what they already discussed in the poster sessions. So I'm sure some of them are maybe still in the Slack, so you can also reach out to them there. And the same goes for the second oral, which is also an excellent paper, which, no, this is not what I wanted. This is what I wanted. Neighborhood aware scalable temporal network representation learning. And there it goes exactly the same, right? You can go back to the streams that we have on YouTube and watch their oral, and you can reach out to them via our Slack or, well, via their emails. I'm sure they would be happy to chat further. So with this, we have our two best paper awards of this year, this iteration of the Learning on Graphs conference. And of course, there were many excellent papers, but these were as the like our program chairs based on all the reviews. They chose the orals first of all, and now they also chose these best paper awards. And yeah, with that, I again have to say a huge thank you to our program chairs who really put hours of work into finding the review awards, finding the best papers, finding the orals, choosing which papers to accept, which to reject. Yeah, I'm entirely beyond grateful for all of their work. And it's amazing to have people like Bastian Rieck and Laszlo Pascanu who just they just go ahead and put themselves out there and do so much for the community. So they are very selfless and amazing. Then we have the same, which can be said for our top area chairs, which we already announced in the opening remarks. But I just want to reiterate how important it is that we have all of our 45 area chairs, right? And they also put a lot of work into finding the papers voluntarily, as often as with all of these conferences, right? They're not being paid, and they're just doing this amazing work and writing sometimes very long texts, as often also, of course, very concise summaries of all of the reviews. And I mean, here at the Learning on Graphs conference, I was especially happy how the area chairs encouraged discussion between the reviewers and the authors. So I think this is an extremely important part of the review process, and with the area chairs encouraging it like this, that makes the review process much better. Of course, then we have to thank the last, maybe most integral part of any conference, which are the reviewers. Not only the 20 listed here, right? It is, of course, all of the reviewers. They did an amazing job, but we want to recognize this. We want to encourage people taking the time to write extremely good reviews, to go into detail in the papers, and not just to write a quick review to have the stuff out of the way. We really want to encourage good reviews, and we have multiple ways of doing that. And we think there are many aspects of the Learning on Graphs conference that maybe encourage these high quality reviews. But one important part are definitely our monetary rewards. And with these monetary, they would not be possible without our sponsors. So this is maybe then the last thanks I have to say to our sponsors, because the contribution that they are making here, this money is definitely not wasted. This money is going to one of the most important parts of a conference, which is the review quality and improving the review quality like this. So I think it is really amazing that our sponsors did this, and just make this contribution to the research community, to the research in the space of learning on graphs and geometry. So we have these amazing review awards to our 20 awardees. And we heard the many things that Fabrizio Frasca said in the opening remarks, and the interesting things about reviews. So I think there's a lot more to discuss and a lot more we should think about. And let's do that. Let's do that for the next year of the Learning on Graphs conference. But before we talk about the next year, I also want to make sure that we all know this year things are still happening. Like here at MIT, for example, today is the local meetup in 50 minutes, I think, yes. And we also still have the meetups in Mila, in Paris, in Germany, in New York, in Athens. And I think there might even be more to come. So keep an eye out for the meetups. And if you're interested in any of these places, you can ask about it in the meetups channel in Slack. But this is for this year, and for next year, we are very much looking forward to seeing you, first of all, but we also have this feedback form here, which Chaitanya will send into the Slack, and we would be very happy to have any of your feedback, and yeah, we'll make it an even better Learning on Graphs conference next year. Also, if you're in any way enticed to maybe win a reviewer reward next year, or just to contribute to the research community and have a write a review for making the research for making the next iteration of the Learning on Graphs conference possible, then stay put for our next call for reviewers, and we would be happy to have your application there. Also, we would of course be happy to see any of your paper submissions in the next year. But then I want to conclude with saying thank you all for the amazing feedback as well. On Twitter, we've seen many comments already, but of course, we want the feedback. I mean, good positive feedback is amazing, of course, but the feedback that's really valuable and that's really actionable maybe, and from which we can improve the next iteration and maybe take some ideas. This is probably most of the time the critical feedback. So please go ahead and use this feedback form that Chaitanya sent into the Slack chat, and let us know what you think, how we should improve. We already have a long list of things to address next year, and already received a lot of feedback during while the conference was going on, a lot of feedback before it, and we really pay attention to what you're saying. And just this morning, for example, we had another discussion in our internal organizing group about some feedback that we got and how to best incorporate it. So please, your feedback is valuable to us, and we do think about it a lot. So let's go ahead with that and make next year even better. We will do our best to organize it as well as possible, and maybe we will also reach out to some of you to help us organizing, because I know that some of you are very much interested in that. So with that, I want to end the Learning on Graphs conference, the first Learning on Graphs conference in the year 2022, and say a very last thank you to our reviewers, to our organizers as well. Thank you all, to our area chairs, to our program chairs, to our sponsors, and to all of you attendees. Thank you and see you. Enjoy the meetups.